Okay. Good morning, everybody. We'll go ahead and get started. A little bit late today, 9:37, sorry. But we are at the University of Minnesota for our April quarterly meeting. I am Erica Sawatzke, board president for the last day. So I am a turkey producer from Kensington, Minnesota.
Steve Neal, beef producer from Northfield.
Good morning, Brandon Schaefer, a beef and cattle producer from Goodhue.
Brian Gates, state veterinarian for Minnesota and executive director for the Minnesota Board of Animal Health.
Eric Jopp, assistant director, Board of Animal Health.
Steve Schaefbauer, emergency disease response coordinator, Minnesota Board of Animal Health.
Medina, director of government relations for the Department of Ag and the Board of Animal Health.
Melissa Smith, business manager for the board. Katie Cornille, senior veterinarian, Board of Animal Health, cattle traceability and concentration plan.
Dan Callahan, communication specialist for the board.
Crystal Lautenschlager, I'm with Poultry programs with the board.
Andrew Gladys, board staff attorney.
And Lucy Hunchbaker, the director of food and ag security teams, can be title for with the Minnesota Department of Ag.
Steve Cavisto, senior veterinarian with the board, companion animal programs.
Greetings, Stephan Schaefbauer, area veterinarian in charge for USDA APHIS veterinary services.
Shauna Voss, veterinarian, assistant director with Minnesota Board of Animal Health and the Poultry programs.
Stacy Holzbauer, state public health veterinarian with the Minnesota Department of Health.
Alex Sadie, board member, cattle producer, and member of the Shockton and Sioux community.
I'm managing editor for the marketing and communications team at the College of Veterinary Medicine.
So I have my daughter Emma here with me today. She is 6 and loves turkeys more than I do.
Dr. Peggy Ann Hawkins from Northfield, Minnesota, a swine veterinarian.
Do we have Dr. Fox on remotely with us?
I am on, I'm almost there. Jessica Fox, I'm a mixed animal veterinarian from Southwest Minnesota, and I'm a director on the board.
Dr. Abby remotely with us? Doesn't look like it. All right. Is there a motion to approve the minutes from our February meeting?
I so moved.
Motion, is there a second? Second. Been moved and seconded to approve the minutes. Is there any discussion? All in favor, say aye. Aye. Opposed, same sign. All right, is there a motion to approve the agenda for today?
So moved.
Is there a second? It's been motioned and seconded to approve the agenda for today. Any discussion? Being none, we'll vote. All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Looks like Brian, you are first on our agenda.
All right. Welcome, everyone. Thanks for joining us. I was kind of excited about today's updates because there's not a lot going on. I don't want to say that real loud, but we're in a little bit of a lull. So it was kind of fun for me to look at what we talked about last year, and I got the bright idea to do some comparisons year to year. So just to show you where some of the diseases we talked about last year are and kind of the current events. So without further ado, we will start with foot and mouth disease. So this was the picture last year. We had those outbreaks in Germany, Slovakia, Austria, Hungary. That's the map over on your left. Those incursions were taken care of. The countries actually have been able to self-declare free of that disease. And then this is the update for this year in 2026, actually real recent. So in February this year, Cyprus had detections of foot and mouth disease in some cattle. That actually spread to some sheep and goats as well. And then just last week, I believe it was, Greece also had a detection of foot and mouth disease. So just a comparison of where things are at. Again, these incursions of foot and mouth disease in Greece and Cyprus, they don't know where they came from yet. They're still doing the sequencing to determine. It's looking like it's closely related to an outbreak in Turkey. So that's likely just what's happening there. What I've read about it, it seems like there's a lot of illegal movement of animals, some even illegal ownership of animals. They've got some strict regulations on what species you can have and can't, and they're determining that some of these affected premises have not even been registered with them. So that's the latest on our foot and mouth disease outbreak nationwide, or actually Europe, I guess is what I was focusing on. And then just a reminder that we're also participating in a foot and mouth disease exercise later this summer. So in conjunction with Department of Ag, we're doing a multi-state exercise, foot and mouth disease vaccination. So we're actually going to have a vaccine placebo shipped to us and stored, distributed, and injected into a beef farm and a pig farm, just to go through the whole process, determine if we've got our ducks in a row, if we have a foot and mouth disease program and vaccination program specifically that will be effective. So looking forward to more preparations on that. And thanks to Lucy for organizing that for us. I just volunteered as Lucy. Lucy took over the organization. African.
Brian, can we reshare the presentation? Sorry, the slides aren't working on.
Yeah, stop my sharing. Oh, took away my sharing permissions.
While we're waiting, does anybody remember what day we had our April meeting last year? April 1st. And did it snow? Yes, okay, I drove home in snow last year. And tomorrow, there's another chance of more snow.
Might want to look at our calendars first. Oh, it's worse. While we're waiting, I wanted to welcome back Dr. Schaefbauer. So Dr. Schaefbauer is back from the point. Thank goodness we missed her and she's hit the ground running. She's been very active supporting us here in Minnesota. So welcome back, Dr. Schaefbauer. Real good?
Yeah, we're good.
African swine fever. So just to overview, not a lot of change really in the landscape over in Europe. The Lithuania is kind of the latest suspect case outbreak area. Not surprising. These white areas are just not reporting if they've got cases. So this map really reflects commercial operations. And I bring that up because these white areas aren't necessarily free of African swine fever. In fact, we've been hearing a lot from Spain and their wild boar population. They've been getting some detection. So it really looks kind of the same for all intents and purposes when you consider the wild population. A little bit unnerving because it feels like we should be making more progress on this. We would hope our partners over in Europe would be having a little more advancement of freeing their countries from that. So keeping close tabs on that. Nothing any closer than the Dominican Republic, like we've stated in the past. We're doing a lot of revamping of our African swine fever plans. So making sure that Minnesota is prepared, tweaking things as needed. I'm actually serving on a subcommittee for the USHA Committee on Swine to go over the Red Book and some changes to the language in the Red Book, procedures, protocols, that sort of thing. Current topics are permitted movement, so how that's going to look. And I'm glad I'm on there because they keep wanting to refer to how we do it with high path. And I keep reminding them, this is nothing like high path. This virus doesn't work the same. The industries don't work the same. So the spider web of movement in swine is going to be very different than in poultry. New World Screwworm. This is kind of our poster child of events that we're anticipating. So again, off on your left is what we reported last year. This is when we were just starting to hear of those incursions in the southern part of Mexico. And here's where we are today. So this is as of last week, the detections. Tamaulipas is this state just south of Texas. And that's where a lot of the cases are being reported. They're all within, or at least 200. I think we maybe had one that was like 157 miles away from Texas. But really, that's kind of the state that we're paying attention to. Nothing in the United States yet. This green area is just to show you where the polygon for release of the sterile male flies is. So they've shifted that to include parts of Texas to make sure that we are keeping active support in that area. It is across the board. The animals that are coming up positive with New World screwworm, everything you can think of. So we've got cattle, we've got dogs, we've got pigs, we've got people. The reports are kind of interesting. They identify, if these animals have moved or not, if they're residential animals, but then they also kind of talk about the wounds where the parasites are found. All of the cases for the last 2 months have been residential animals. So that means these haven't been brought in. They haven't been smuggled in, which was the original transmission of this parasite. So these are resident animals indicating that the parasite is residential. The New World screwworm fly has set up shop in Tamaulipas. A lot of neonates are showing signs around the umbilicus, so that's what we expect. Just when you think of flies, where they go. Some of the more interesting ones, it's actually been interesting to see the ages of these animals too. I think there were some cattle that were close to 20 years old that were positive. So whatever that means, I just thought it was cool that they've gotten cows that old. One of the more interesting incursion sites was bat wounds. A couple weeks ago, they had several cows that had lesions that they attributed to bat wounds. So they have vampire bats in that area that like to feed on the cattle. As far as what we're doing here in Minnesota, I think I mentioned this last time, we submitted proposals for the New World screwworm Grand Challenge to do a little more vetting, a little more research into companion animals and how they might serve as a vector or transmission to Minnesota or these northern climate states where we don't think the flies would exist. We talked a lot about how the movement of companion animals has improved or increased a lot. We've got a lot of people vacationing with their pets and vacationing to these nice warm areas where the parasite exists. So we want to know more about how we're controlling that. What are we doing at borders? How are we controlling movement once they cross in? So not just visitors with their pets, but also rescue groups that are bringing in feral animals, feral dogs. And we've heard that feral dogs are one of the worst issues in Tamaulipas because they're not really controlled. So we've got a lot of rescue groups that like to bring animals in from those kinds of situations. They wouldn't necessarily come directly to Minnesota. They would probably stop in Texas or another state along the way. So what's the breakdown on communication for us? So does Dr. Cavisto know that this dog actually came from Mexico, or is he getting a CVI that says it came from Texas or New Mexico or somewhere else? So we want to know more about that. We also want to get some educational materials out to people and veterinarians that are treating these animals to understand the drugs that are now available for prevention. We've got a lot of things that have been released by the FDA to prevent and treat New World screwworm in companion animals. So being able to get that information out to share with our colleagues to ensure or to diminish the possibility of that parasite ending up here. And then there's also a component of it that we're working with Department of Health to work with our producers who have migrant workers that might be bringing the parasite back and forth, or just to make them aware of the risk of the parasite coming from where they are originating from. So more to come on that. Texas, I think I mentioned this last time, has declared a state of emergency over this. It's not in Texas yet, but the governor feels that it's only a matter of time. I think we're kind of seeing that warmer weather is coming, and there isn't a lot of control over the wildlife with this outbreak in Mexico. So I would speculate that it is probably a matter of time before we start seeing those parasites showing up in Texas. Hopefully we can minimize it and help push them back. This is a fun slide for me just because it seems like we don't have to worry about it. I shouldn't have said that about So this time last year, we were talking about this new national surveillance plan for milk sampling. So H5N1 in dairy cattle was still kind of circulating in the US. We really hadn't had anything in Minnesota for a while. So this was just USDA's attempt to determine where is this virus in dairy cattle? What are we doing to get it out of circulation and be able to have a better idea how it's moving around. So we partnered with Department of Ag to do the sampling. We had one cow that came back positive. I can remember this. It was a weird case. It was a repeat case from a farm that was one of our positive farms. And we tested this farm multiple times and finally got it down to one individual cow that was contributing the virus to the bulk tank. So that cow was sent to Ames, Iowa for more research with USDA, and we became free of H5N1 later that summer in dairy cattle. So that was the only positive we had from that surveillance. And then just to give you overview what it looks like nationally. So again, on the left side, that's where we were at last year. California and Idaho were really still on fire with this virus circulating. The rest of the country was pretty quiet. We didn't really see too much happening. And then this is where we are today. So 2 additional states, I think, were added. Nebraska and Wisconsin had detections. I think Wisconsin was the last detection. That was back in December. So since then, no detection. So they don't even send me out reports anymore because there's nothing to report. So it appears that we have gotten on top of this. The sampling continues. We're still doing silo testing. So we're not doing the individual bulk testing for Minnesota. We're doing silo milk testing. So we're still doing surveillance, but all that looks great. But just a reminder that this is not just a disease that affects poultry. I think this is a real eye opener on diseases that can affect multiple species. Probably a taste of what foot and mouth disease might look like. And are we prepared or aren't we? How do we work together? I think those were a lot of great lessons that were learned from that outbreak, and could it come back? So the other thing to point out, so these new detections that I referenced in Nebraska and Wisconsin this year were a different strain of the virus. So we talked about the B313 last year with kind of being the dairy strain. And the cases that were detected this year or over the past year were the D1.1 strain. So the same strain circulating in wild birds, and it appeared to be individual introduction. So a different way that these cattle were getting infected. It wasn't from other dairy cattle, it was actually from wild birds. And then it didn't seem to spread from there. So just to point out that the virus is never the same from one year to the next. We see that in our poultry, just the way it moves around in different species of birds, but certainly is becoming more evident in our non-poultry species. And brucellosis. So just a quick overview of our companion animal program. This is really what's kind of on the radar for us. Recently, we had another detection of canine brucellosis. This was mid-March that we had this detection, kind of the same scenario that we've reported in previous outbreaks. It was a rescue dog from a reservation in South Dakota that was brought here by a rescue group with the litter. One of the puppies that had been adopted about a year ago was referred to their veterinarian for neck and back pain that didn't seem to resolve. The veterinarian tested it and came back positive for canine brucellosis. So that starts a flurry of activity for Steve and his crew to hunt down where the rest. So I have a litter of 8. It was actually a litter of 10. That becomes important. Not the number, but so we've got a mother and a litter of 10 puppies that all got adopted a year ago, and we have to circulate this information to them and explain to them the ramifications. If this is a positive, you have 2 options. It's lifetime quarantine of the dog or euthanasia, because there's no treatment for brucellosis. So this one's been a struggle. There was a lot of misinformation that was going around just from the rescue group, from veterinarians, suggesting that it's not likely that your dog is going to have this because that was over a year ago. So it couldn't possibly be that. In the end, the mother tested positive. 4 of the puppies tested positive. 2 tested negative, and 2 were waiting.
4 positive, 4 negative, and 2 were waiting on. And then the mom was positive.
So not a this is one of those lose-lose situations. I keep telling people that no one wins in this. The rescue group looks bad, we look bad, the owners feel bad. We've got to do something more about this. How do we prevent this in the future? The frustrating thing has been that this is the third outbreak from the same reservation. So in recent history, and we could go back farther, and I think we're going to find it's the same reservation that has brought that brucellosis here. We also learned that the same veterinarian was writing the CVI to bring these dogs into Minnesota. So that's where I go back to the litter of 8, and the CVI doesn't indicate those puppies came with it. Just indicates the mother came, says that the mother was tested. Unfortunately, we don't have what tests they use, what the test results actually were. There's a variety of tests that are utilized for brucellosis. Some are good, some are not so good. We suspect the not so good one was maybe used in this situation because the mother was the one that was tested. So anyway, brucellosis is still a thorn in our side. Future prevention. We're trying to figure out how to get a hold of this or get in front of this. So Steve's been working with the rescue groups, getting some information out to other rescue groups that might be trying to service this particular reservation, just of this risk. It's not just the risk of you're bringing this disease to us, but you're risking these families that are adopting those puppies and the heartache that they're going to go through. It's never within a month that you got the dog. It's after you've had the dog for a year, sometimes a couple of years. You're all attached, and then we have to come along and say your dog has a death sentence, basically. So what can we do? We're trying to figure out if there's a way to restrict movement from that particular reservation without specific testing. There's a few different things that we're talking about to try to eliminate that. I think just this information that we're gleaning, that these are all coming from the same place. We have a veterinarian in common with all these. There's some avenues that we can maybe get involved in and slow down the spread or reduce the incursion of this one. It's a frustrating one. It's probably one of the worst things that Steve and his crew has to do. There's no good news with this one. Other stuff going on in the companion animal world. We are in the middle of our audit from the Office of Legislative Auditors. So again, that was an audit of specifically the companion animal program. So ongoing, Steve and staff have been providing a lot of documents, interviews, and here's everything is going well. We will have results. I think she said it would be later midsummer anyway. I mean, it's not a quick turnaround. There's a lot of information she's gathering. She will be joining someone on I think a kennel inspection and a breeder inspection. So doing a thorough investigation, but everything's looking good so far. All right, my last change of the year. So that was our board last year. So we're losing Erica. Alex's position is still up in the air. He's up for reappointment or replacement, I guess. So we're waiting on the governor's office to select individuals to fill those roles. So more to come on that. And my last slide. We need to thank someone. And if I can get Erica to come up here. So I haven't been around as long as Erica, but just about. I don't know if anyone that's gone through as tumultuous and entertaining and exasperating, maybe tenure on the Board of Animal Health, but we certainly thank you for your time and your commitment and leadership. So you've got a plaque. I'm going to read it to you. Ms. Erica Sawatzke, in recognition of your distinguished achievements as a member of the Minnesota Board of Animal Health, you have continually demonstrated your outstanding dedication through your service with the board as president and a poultry producer supporting the health of Minnesota's livestock. Your leadership and support have been exemplary. 2018 to 2026. Thank you. Shut y'all down.
Yeah.
Oh.
Don't think, we were doing this last, but I'm gonna change the.
Brian, before you sit down,
Yeah, we've got questions.
just kind of rewind back into your dairy influenza circumstances, the fact that we're negative now, and as we reflect on last 18 to 24 months, what, and not maybe not just you, but from staff, what are the things we can extract from that performance and that experience that we make sure we put in our tool bag as we go forward towards who knows what's next? Was it the communication through industry? Would you give me some feedback so we don't just chalk it up to success, but how do we learn from the success, make sure we can replicate that?
Yeah, absolutely. Great question, great point. Yeah, I don't want to make this sound like we're done, went away, we don't have to worry about it, because that's exactly where we were with high path in poultry in 2015. Kind of went away. We didn't really see it. We didn't have this ongoing event that we have now. And again, I think it was a harbinger of other diseases that we have to be aware of. Those that we know of, foot and mouth disease, and those that we aren't aware of. So I think more engagement with the industry. I see Lucas is here, and we were able to generate some great conversations, engaging all parties in this to make sure that everyone understands their role and understands everyone's predicament. I think that's a big part of it. So recognizing that we aren't siloed in our commodities in Minnesota. Everyone's connected somehow. So it might not be directly, on the same farm, but you might have the same feed mill, you might have the same veterinarian, you might just use the same road. So just understanding the inner workings of your neighbors, your neighboring industries, how we work together and how we can support each other and be part of the solution. Go ahead, Lucas.
You probably have a few things going on, so you may have forgotten. We just did an after action review last month. So anyway, we worked with several of the veterinarians in the room and many outside the room and lots of industry. And so Dr. Cardona, I think, is the one who called the notes, and we have a detailed list of here's what we missed, here's what we do different next time, here's what was really great. And so I think we spent a couple of hours doing that. We kept meeting regularly until last fall, and then I don't want to say it's over, but that was our last meeting was that last month or February we met and kind of went through that. So I'm sure you can have those notes if you want them, but Dr. Cardona took those. We all discussed what we missed, what we excelled at, what we would do different.
And then I want to reiterate, it's not just dairy. So we got to think about how do we work between beef and sheep. I mean, there's other industries that weren't involved in this, but it's an eye opener. We have to be considering what things could come and go and spread across different species.
And then just kind of overlapping into that and coming into your next topic was the canine brucellosis. And a couple questions I just had from a biological standpoint: what's the incubation period of that disease in order for detection in a puppy versus an adult? And yeah, I guess how do we better educate ourselves as to what's the critter carrying with it when it's in movement?
That's the tricky part with the incubation period. Some dogs will be carriers of it for years and never show a clinical sign. And that's what's happening a lot with these puppies. Some of them are being tested at 8 weeks of age before they make their way up here, but you're not going to find it in an 8 because most of the time these are antibody tests.
Yep.
And so it's almost clockwork, a year and a half, after they get here, they're popping positive, some more dog will come up and become ill. I think unless I've reached out to some of these rescue groups and I get to say a lack of cooperation would be putting it kindly, I guess, if you can say that. I think we're going to have to look at it as educating veterinarians and the pet owning, for the people who are getting animals from rescues and saying, ask the simple question, where did it come from? And then knowing that, understand that there are some areas that are a higher risk of this, well, not just this, but in this case, this bacteria. And if your dog pops positive for this is what the consequences are going to be for you. And that's the one thing I just asked is that, just be honest with people. You brought this dog in from this particular area, let them know. And the response was, we let them know they won't adopt the dogs. And I think that's the point. But So,
And just to add on to that, I think it also showcases kind of our limited oversight of rescue groups. So we have inside information on shelters. We inspect them. Rescue groups are kind of running under the radar. And this is part of the problem with that. So it's not just brucellosis, New World Screwer. I mean, that's my concern, that's the organization, those organizations are going to bring them up here. And nothing against them. I think their heart is in the right place. They're trying to find better lives for these animals, but I don't think they get the full scope of the risk that they're bringing to the rest of the community. So, good people, nothing against them, but I don't think they have all the information and maybe, an objective overview of what they're doing. I think it's almost a race to rescue as many as we can without stepping back and thinking, let's rescue the ones that really can have a life and provide good homes for those.
So obviously, I guess I just draw alignment between this and how, say, the influenza in the dairy. It's all about how you respond, and you know, in the world of agriculture, it becomes more of an economic impact rather than it's an emotional one too, but we tend to measure things in numbers. And I don't know, from a regulatory standpoint, obviously you're crossing state lines, you're probably crossing over into sovereign circumstances within the native population circumstances as well. All those things aside, but how can we get in front of those circumstances to try and mitigate before we have to eliminate?
Mhm.
So.
This is also one of those areas that I've phoned a friend. So Dr. Schaefbauer, representing the USDA, has some other avenues that we can pursue because we're talking interstate movement. So there's if there's a violation of imports that the veterinarian and their accreditation is subject to, then we might have an avenue that way. But it's not always easy to get those sorted out, and it's not one of those low hanging fruit kind of situations. It's another lose-lose, you know, there's not a lot of great cooperation on those kinds of things. The end game is just to make everyone more aware, make their animals more safe.
Okay, I'm a swine veterinarian, so I'm gonna just ask this question. Brucellosis is a zoonotic disease that can affect humans. How likely is it from a dog going to affect humans?
I'm gonna ask Dr. Holzbauer to comment on that.
If you're willing to wait, is the main focus. But yeah, I mean, it's essentially, it's another example of the coordinated surveillance that we do with the Board of Animal Health. So Steve's group lets us know as soon as they have positives, and after they've done their initial investigation, we're following up with the owners and talking about the zoonotic risk, and also reaching out to the veterinarians that are treating themselves too. So I'll talk.
Oh, I got more questions for you.
Okay. That's another question. Dr. Visto, remind me, was the mother, like, what was that mother tested before the CBI was issued?
yeah, so according to what's written on it, so there were 3 dogs listed on the CBI, 3 adult dogs. And underneath that, it said all were tested and found negative for brucellosis.
So there's standard test that,
We don't know what this, so that's the trick. So there's not, and the test, from what I gather, I've never heard of the one that they're using, and I've asked the company that makes it, that also makes a on-site rabies test, which we're very curious as to how that works. They haven't responded to let me know what the sensitivity or specificity is really. So, yeah.
Another question on that. So is it well, I already know the answer. So the state regulates, the state where the animal comes from regulates what's acceptable and what's not acceptable.
As far as
testing or.
I don't think
Or do we could come in here,
there was a regulation, I would say.
So the biologics that they use in the state would be regulated by the state. So for example, if someone wanted to develop a brucellosis or rabies test here, they would have to submit to us for allowing that. So it would be the state of origin that.
But we can't say, well, with pigs during pseudo rabies, the state you were sending it to had specific wording they wanted on your health certificate. We couldn't do that. We couldn't say you can't bring one in.
We can alter the wording, but they did that. So she wrote on the health certificate that they've been tested. I would be more curious how and what test was used. So that's what we're kind of looking
List
into.
of qualifying tests.
That's what I'm looking into. Can we identify, these are the required, you can use one of these required tests that we'll accept. And then I would like to see the results from the test, not on the handwritten report from the veterinarian.
I have one last question and then we probably should move on. If a pet owner would decide a lifetime quarantine for their dog, what does that look like for the board? And that's kind of an open-ended question, but you know, when we look at movements of our four-legged livestock, I mean, you know, we track that and we can kind of control that. But in a pet dog, what does that look like for the board, if that were to be chosen? I don't know that anybody's done that, but
They have, yeah.
they have.
Yep. Essentially, so there's initial contact with them, you know, a site visit, go to their home.
Yeah.
See how they're set up, how they plan on meeting the requirements. Hopefully they have a fenced in yard, and then they get checked on once a year. Yeah. Anytime the only place the dog can go is to the veterinary clinic. So when they need to go to the veterinary clinic, they contact us to get a movement.
Sure.
Yeah.
Thank you.
Yeah.
Anecdotally, so I've got classmates that worked out in California, and they were dealing with some of the same stuff out there. And as you can imagine, it's not easy to police these. Livestock are easy to track than companion animals. So she had one client that had a dog that tested positive for brucellosis, and they wanted to move to Tennessee. And she's like, you can't. And she said, who's going to stop me? And off they went. So best you can do is tell Tennessee, hey, someone's, but you know, they don't have any forwarding address or anything like that. So it's really hard to police when, I mean, you're kind of talking about quarantining a family member, so.
All right, well, thank you. Lots of information. Michelle, go ahead.
Okay, morning all. I have just a quick legislative update for you all. So currently we're on the legislative break for the Easter Passover. So we started on Friday at 5 p.m. and we go until it's coming Tuesday, April 7th at 8 a.m. So there's nothing official happening, but there is still some movement. They're getting some different work on different committees, but nothing official for this week. So for bill numbers, we're at 4,790 bills in the House and 4,532 bills introduced in the Senate. And we've already passed the first and second deadline. So that was on March 27th at 5 p.m. So the first deadline is for committees to act favorably on bills in the House of Origin. So that's which body they were introduced, whether that's the House or the Senate. And then the second deadline is for committees to act favorably on bills or companion bills that met the first deadline in the other House. So this passed last Friday. So there shouldn't be as many bills coming out now, especially policy only bills, because we've already passed that deadline. And then the third deadline is for committees to act favorably on major appropriation and finance bills. And there's a caveat to this too, that there's no deadline for introduction of bills that can be introduced all session long. But the deadlines, like the first, second deadline for policy, they don't apply to the House committees of capital investment, ways and means, taxes, or rules and legislative administration, or the Senate committees on capital investment, finance, taxes, or rules and administration. So essentially what that means is any bill that has fiscal impact, whether that be a budget neutral, so a zero impact, but there's still money kind of moving, but it's neutral. All those bills have until the third deadline to work through and to have more time. Any questions on that? Okay. And I'll say even if a bill missed the deadline, they can still be added in. So bills can be added into omnibus bills and be added in as amendments on the floor just because a bill missed the deadline doesn't mean that it's done. I would say it's still available and in play. So any bill from last session, any bill this session could still be added, different pieces. I'll go through just a couple bills, for the board that we're watching. So Senate File 4561. This is Putnam's bill in the Senate, excuse me, and House File 4350, Hanson's bill in the House. It is the agency's Department of Ags. It's our policy bill. Essentially, so it has a lot of policy things. The one thing I want to flag is that there was an A9 amendment added in committee in the Senate on March 25th. And what this one does, it removes within our statute, the board statute, section 35.155, subdivision 4. It removes the language and physical contact between farm survey and pre-roaming survey. So that's for the survey program where the fence requirement, that caveat is removed from the board's language, or from our statute language. So that's the physical contact part of that. So that is in the Senate bill. It is not in the House bill. So that amendment was added in that. So that's kind of the biggest, I would say, thing for the board. We don't have any other policy bills within that for the board. And this one was brought by a legislator, was not brought by the board. But just flagging that that was included. It's not in the House bill yet. We'll see if it does get added, but we'll kind of just keep tracking that one. There are quite a few bills from last session too on farm survey fencing, the authority of farmed whitetail deer sending back to the board. There's still just a lot of those kind of elk inserted bills that are that have been introduced. And there's been a couple this session too as well. A lot of the farm survey, location data. Senator Green and Representative Heitzman, it's Senate File 4715 and Heitzman's 4508. It exempts elk from the live survey importation prohibition. So just a lot of different ones. I can send out a list too if people are interested in kind of seeing the ones that are watching. A couple other ones that have had some hearings this session is the Office of Animal Protection Establishment and Appropriation. So that has been heard in the Senate committee and laid over, and now it was referred to local government. So that bill is moving through. I will say there's an appropriation for this bill. I believe it's over $4 million each biennium. So that is one bill. I think on this one, yeah, so that one's still moving. But again, it has access to the budget. Also in the House File 1857, Smith's bill, elective decline of tax prohibition. Again, not quite our jurisdiction, but one bill that did get a hearing in House Ag. This was included last session too, and it was included in our omnibus bill that the board of Vet Med had to do a study, kind of check, see what the prevalence of the disease was, and they did submit that report earlier this year, so that's available. And then just flagging one to Senate File 1945 Dibble and House File 2627 Norris. It's a pet shop's prohibition from selling cats and dogs. So this is at hearings in both the House and the Senate. And so that one also is moving, again, not our jurisdiction, but just kind of some adjacent bills of interest with like a company animal program. And those are the ones that I have kind of that we're watching and flagging. There's more bills, of course, but I'll say this year for the board, we're kind of quiet on bills. Again, it's a policy year. We don't have any policy items. Next year will be budget, so there's no budget items for the board this year. In the governor's supplemental budget, the Department of Ag did not receive a budget cut. So our budget is fully intact with the governor's budget, which is good. That means the board's budget also is fully intact. So we're not worried about any cuts or reductions to our budget there, which is really helpful. This session's weird. We have an election coming in November. This is a short session, so we'll have to end by May 19th. So we have just more than a month. We got a little bit of time left. So we'll kind of see what happens, but it's hard to say how much will or won't get done this session. I would say there's been, it's been interesting so far, I guess I'll say it's politics, but I think for the board, you know, we don't have much to work on this session. I think next year, I think we're kind of hitting some policy that maybe we want to look at and some budgetary increases we might need in some different places. So we'll take a look at that over the summer and then prepare that to be included in the governor's budget next session. But for this session, we're kind of just tracking things, able to testify as needed. Dr. Hayes did testify in Hoefs and then briefly in the Senate on animal diseases as well. So good to have him available and be in committee. Any questions? Yeah.
I kind of just want to get this into the minutes and my thoughts on this anyway. It looks like our budget is safe, and so we've got the money we've got, but we do know price of gas is going to go up enough to make a difference in our budget. And so I think as a Board of Animal Health, we need to be thinking about how we're going to manage those costs and still get the job done.
For sure. And last session, we did have an increase. We did ask for an agency increase to catch up with a little bit of that. It wasn't enough, I would say. I mean, I think we do a lot of work and we cover the entire state. We're a very small agency. So I think that will be another thing, looking at how we, you know, ask for another cost of service increase for the agency next session, I think will be important. So we'll do that with the budget year. But the supplemental budget, there's a little bit of money available, and I think most of this for this first biennium, but then into the tail, so 28, 29, we have a structural imbalance. So we're in the red. So we'll also see that'll be a little harder for this next budget session because we're not gonna have that much money available either. But I think also some of these emerging diseases and concerns we have, we really need to look at our budget and kind of look at what we need to have available and ready to prepare. It's helpful that with the Department of Ag, we do have the Ag Emergency Account. So we do have about $2.5 million in funding that we can tap into a little bit to do some of this response. And so that's helpful to have that, but that's also what that's what the Department of Ag, we do partner. But I think New World Screwing, to Dr. Hayes' point, is it's established in Mexico and it's not that far from us. So I mean, we have a lot of cow movements, from the border, also depending on animals and that. So I think we need to really look at, if we need to respond to that, what we're going to need for resources, because it's not going to be cheap or easy. And we have great partnership with the department and Department of Health and the USDA on this, but it's a big unknown. So yes, funding is always important. So we'll work on that for next session. If I'm here, hopefully we'll see. With the election, we'll see. I am appointed by the governor, and so if the governor changes, my job is not guaranteed. So we will see come November and January what that will be. So
that's the point. I just want to emphasize, we've got all these plans on how it's worked in the past, but we're looking at a whole new administration next legislative session. So hold on to your hat.
Yeah, whole new administration and a lot of new legislators as well. And there's a lot of retirements. There's more, there's a lot of people moving between the House and the Senate or taking other jobs in local government. And so there will be quite a few new legislators and a whole new administration as well that we'll have to kind of work through in that. So next session too will be a lot of education, a lot of, I'm reaching out to legislators and the administration of what the board is, what we do, and our importance to the state.
Any other questions for Michelle? All right, thank you. Thanks.
And the next time you see Michelle, she will be.
Rachel, give mom love. Is Dr. Naikare joining us remotely?
Yep.
Good morning, Erin. Can you hear me?
Yes.
Okay. Let me try to share my screen.
That's true. And for
All right, good morning, everyone. I hope, is my screen seen, like the College of Veterinary Medicine update slide? If you could just give me a thumbs up or just let me know.
We can see it.
Yes.
Okay. Well, good morning. I'm sorry I couldn't be there, and neither Dean Molgard. She had some scheduling conflicts, and so on her behalf, I wanted to present the CVM's updates. I am on the West Coast and with the kids on spring break, so I couldn't be on site. I have 6 updates from Dean Molgard to talk about. So the first update is to do with legislative updates. And within the legislative updates, you can see that the Veterinary Practice Act, and then we'll talk about AGREET, which is Agricultural Research, Education, Extension, and Technology Transfer Programs, and then about the Loan Repayment Program. So the CVM's Dean Molgard joined members of the board of the Minnesota Veterinary Medical Association and the Minnesota Association of Veterinary Technicians. They traveled to St. Paul for the annual Veterinary Day at the Capitol on Wednesday, March the 4th. Representative Paul Anderson joined the group for a Q&A on current legislation, including HF 3718, which updates the Minnesota Veterinary Practice Act. Then Dean Molgard also joined peers from the College of Food, Agricultural, and Natural Resources, CFANS, and the Minnesota Extension folks to provide testimony and answer questions about AGREET program for the House and for the Senate's Agricultural Committees. There were also questions from the committee, including the Rural Veterinarian Loan Repayment Program. This program is very critical to helping address the rural workforce pipeline. Next update we have is on the curriculum revitalization, and that keeps continuing. There had this progress of the CVM's curriculum revitalization has also featured in the JAVMA article, the Journal of American Veterinary Medical Association. Over the past 3 years, the college has engaged in a 3-phase curriculum revision process that was recently featured in a spotlight article published in the Journal of American Veterinary Medical Association. As noted in the article, the defining structure of this revitalization process has been sustained engagement of our veterinary community. Practitioners, students, faculty, staff, and alumni actively shape the curriculum through surveys, they facilitate discussions, and open feedback hosted on our public website. This revitalized curriculum will be implemented in the fall of 2027, beginning with our class of 2031. Next update we have is on the planning that begins for the new isolation unit and the medical facility. Our college has started developing plans for a new equine hospital isolation and farm animal medical facility adjacent to the Letherdale Equine Center on the University of Minnesota's St. Paul campus. This new facility will strengthen the VMC's capacity to diagnose, treat, and contain infectious diseases in horses and large animals while safeguarding the health of other patients, staff, and the surrounding community. It's about 22,000 square feet, designed with reflect best practices in biosecurity, patient care, and species-specific hospital architecture. Moving on, some strategic roadmap on the One Health Action Team. The University of Minnesota unveiled a strategic roadmap last year, and One Health plans a large role in it. The roadmap includes 5 strategic imperatives, one of which is focusing on advancing excellence to lead in the discovery and application of sustainable solutions, improving environmental, human health, and animal health. The One Health Action Team, co-led by Dean Molgard and Associate Dean Jolene Hadrick at the College of Food, Agriculture, and Natural Resource Sciences, has met with a small team of faculty from across the UMN system campuses. They have completed inventory assessments of university strengths around One Health topics with specific emphasis on agriculture and infectious diseases, including existing centers and institutes. The action team's plan will be submitted for consideration in early May. Moving on to the budget forecast and CVM's budgeting. So the university's budget, a funding request from the University of Minnesota is now before the legislature for consideration. The Board of Regents approved the university's proposed operating and capital improvement budgets back in June. The balanced operating budget anticipates approximately $5.1 billion in revenue for the coming year to cover approximately $5.1 billion in expenses. The university has put forth a $284 million request for capital funds, of which $84 million of which would be helping construct a new campus center on the St. Paul campus. The college's budget faces, on the CVM side, the college's budget faces both challenges and opportunities, as is true every spring. As instructed by the university, College of Veterinary Medicine is developing plans for a balanced budget that includes reallocations. And reallocations means cuts of 1 to 5%. And please note, this is on top of the 7% reallocations that all colleges has to achieve last fiscal year. And then the last aspect is about the upcoming events. We have 4 of these. So the CVM will be hosting the white coat ceremony for the class of 2027 on April 11th. Then on May 9th, the 2026 commencement ceremony will be held with alumnus Dr. Karen Shenoy. She's the Vice President and Chief Veterinarian for Hill's Europe, Middle East, Africa unit, as she will be our commencement speaker. And then we will have on May 27th the Education Day, and it will include sessions on spectrum of care, faculty and staff teaching awards, and educational poster sessions. Lastly, our annual Research, Innovation, Discovery, and Education, the RIGHT Summit, will be hosted on June 17th. Those were the updates that I had from Dean Molgard. I just thought I'll check if you have any questions that I could pass on to her. That's all I had from the CVM's updates.
Are there any questions for Dr. Naikare? I don't see any questions on our end.
Okay, very good. Well, let me then go into the updates for the VDL, and I'm trying to see if I can share that screen. All right. If you could give me a thumbs up, this is the VDL update slide Q Q2 2026. Is that what you're seeing? Okay, thank you. Thank you, Steve. So, I'm the lab director of the VDL, and then we have 2 laboratories, one in St. Paul and our poultry lab at Wilmer. So between these 2 laboratories, we offer microbiology services, molecular diagnostic services, pathology services to all the 87 counties in the state. And 75% of our caseload comes from in-state, and the remaining 25% comes from out of state. So since the last meeting, which we had in February, and now, although it's been just 1 month, or roughly about 2 months, I have a few updates. So number one is the equipment upgrades. So in this month, in March, we actually got a new multi-top mass spectrometry installed in our bacteriology section in St. Paul. And this was purchased through the American Rescue Plan money. So we had received $1 million of American Rescue Plan money for Wilmer and for $1 million for St. Paul. This was post-COVID. And this American Rescue Plan funds actually helped us make some equipment purchases and upgrades. So the tall equipment that you're seeing on the left is called as MALDI Biotyper Series 1. This is a protein fingerprinting unit. Basically, what happens is whenever we get samples, say, from any animal, and then we isolate the bacteria, like what you're seeing next to the instrument is a Petri dish with bacterial growth on it. So individual colonies of those bacteria are then taken on a toothpick, and then they are processed, and then they are tested using this multi-top biotyper. Within a few minutes, you get a fingerprint, which is matched against a database, and you have a result. So this is our workhorse, and we actually have 2 of them, but they only have a 10-year lifespan. And so this replacement will really help us make our bacteriology more robust. And eventually, we'll have to find another multi-top for our lab of underhealth, the mastitis testing laboratory, which is also equally busy. And so I'm trying to find funds for that. The other update I have is that in the center, you can see an instrument called as Quant Studio 5, and we have 5 of these needed in our poultry laboratory in Wilmer. Right now, we have a different platform, and that platform is again getting not obsolete at this time, but in a few years, because the company has switched over to Quant Studio 5, and it's just, again, a high throughput, high volume testing equipment. Each of them costs $60,000 to $70,000. So these will be replaced at our NPTL laboratory with the funding that we received from the CDS FY26. So the $1 million funding, which has been committed thanks to our senators, Senator Klobuchar and Senator Smith, those funding will be utilized in replacing 3 to 5 of these PCR equipments and other stuff. So to the right of that instrument, you can see a nice curved graph, and that is in real time when samples are being tested. Those are the results that come out, and in less than 2 hours, you have an answer whether you have high-path AI or whether you have any other like PRRS or other diseases that we are testing for. So good times. Hopefully in a year, we will have more instruments added to the lab. Next update I have is we have just launched our ruminant pregnancy ELISA test. And this is an ELISA testing, which is a serological test that can be done for cattle, for sheep, for goats. And we offer 3 days a week, Mondays, Wednesdays, and Fridays, with 1 to 3 business days turnaround time. The beauty of it is that it could be run also on a milk sample or on a serum sample. We use the IDEX kit, and it's about $7 per sample for testing. So in situations where a veterinarian cannot be available to do ultrasound or do the rectal exam, if we have milk or serum samples, we could actually get to an answer in about 25 days post-breeding for cattle, 25 to 28 days, and 30 days for sheep and goat. At the VDL, we had some recent activities. So on March 28th, I would like to mention about necropsy hands-on training workshop that we did for several of our team members, of our client members of Swine Vet Center. This is like an annual ritual, and we always get field folks come into the laboratory, and we train them on how to do dissection in the field and isolate, get the organs or tissues and send them to the laboratory for further testing. And this was again done on March 20th. So we had a good group of folks trained by our pathologists. Also in March, we had a visit from the Morocco's vet school dean, Professor Abdelaziz. So Morocco Vet School is the only vet school in the country of Morocco in Africa. And 60 years ago, with the USAID and some sort of a collaboration between United States and Morocco, United States helped them build their agricultural program and their first vet school, and this was at 60 years. So we are trying to find ways to learn more about how that program was successful and identify how further collaborations can be extended with our African counterpart, especially on small ruminant side, because they have all those diseases endemic over there, which we hopefully don't get them over here. But those would be really good places to do new test development, assay validation for small ruminant submissions. And this has just happened on March 30th. So a lot of folks in the room are actually there with Senator Klobuchar. So Senator Klobuchar's team visited our poultry testing laboratory in Wilmer on March 30th, and they kind of was given a tour by Stacy Pollock, our lab manager there, to get to know about HiPath AI, how response is happening, and how the laboratory is supporting our stakeholders in Wilmer area. So we are very happy, again, thankful to our team of our stakeholders who have been very instrumental in getting the needed support for the lab. I wanted to include a couple of slides on avian influenza just to let everybody know that through the LCCMR funding, which is the Legislative Citizenships Council, in the state funding which was awarded for wildlife research projects, and two of them are happening at the VDL. So one of them is we are looking into the different diseases of free-ranging animals in Minnesota, and so far we have conducted 272 postmortem exams of free-ranging animals as of March 19th, and we maintain a database on our website. So if you're anytime wanting to know what are we seeing in our wildlife, if you click onto our home page, you'll see an icon for wildlife research. And in that, if you click it further, you will get to know on a monthly basis. We update this Excel spreadsheet. So you would get to know what kind of diseases we are seeing in their wildlife. Also, at the same time, we got funded for surveillance of the Minnesota wildlife for avian HiPath AI. And that is, again, we have a real-time dashboard. This surveillance will actually help us not only for avian influenza, but also for the HiPath AI. And it is, again, real-time. That's just a representation picture of what the surveillance looks like as of yesterday. Again, if you click on our website, on the homepage, you'll get to this dashboard. We were kind of pretty busy in Jan, Feb, and March applying for new grant applications through USDA, and NOFOs is the new terminology that USDA uses, Notice of Funding Opportunities. So last week we submitted two big projects for funding. This is again competitive funding called as SAS, Strengthening Agricultural Systems through NIFA. We submitted for residencies and internship workforce development, but not just for Minnesota, but for the national network. And if we get funded, it's $10 million for the next 5 years. Under the same theme, we also submitted funding for a novel artificial intelligence-based technology called as SIRS, machine learning, and that could help us develop some nice point of care testing that could be used at the farm side. Again, we are working for that in collaboration with the University of Georgia. They are the primary assay developers, and we could perhaps help support the swine diagnostics and the poultry diagnostics for that. So these are the two big proposals that we have submitted this last week. And we are currently working on applying for the Veterinary Services Grants Program for developing food animal residency programs that will really help us to connect our pathologists to, the population health side, maybe make some field visits, get to know how their reports are to be interpreted in the big, from the herd perspective. So we are trying to apply for $300,000 for 3 years. And lastly, I would like to mention about the New World screwworm, like Dr. Hoefs was talking about previously. So from the VDL, we submitted 2 applications. One was for doing a better surveillance. We don't have the disease in the country, but the CVM, in collaboration with our Mexican counterparts, we have requested for a surveillance program, about $2.23 million for 2 years, and also for developing new world screwworm diagnostics, which could be utilized at the farm side or at the auction side, and that would again be for $1.6 million. So thank you, Board of Animal Health. Thank you, our stakeholders, for support with the letters. Those are very instrumental for us to show that we have the things that we are developing are going to be of utility for our state and federal partners. So really appreciate that. We've completed first 8 months. Actually, we are almost done with 9 months, but this is the data of March is still not closed, but this is just to give you a picture of the different sections that the VDL has. The first one we talk about MPTL, which is our poultry testing lab, and all the other sections are in our St. Paul laboratory. And the 2 green bottom lines are important. In the first 8 months, we have seen that our caseload has grown by 8%, and our clinical revenue has increased by 12% for this cycle. Majority of this was because of high-path AI testing that we did, the national milk surveillance testing that we did, as well as testing for California, avian metapneumovirus that kept us busy. So those all things have contributed for the increasing caseload that we have seen until February. The last slide I have is about upcoming activities. The VDL will be participating at the North Central Avian Disease Conference, which will be in Minneapolis on April 13th. We have at least 4 presentations from the lab. And this is a day before the peak Poultry Expo from April 14 to 16 again at the Minneapolis. So we will be participating in that. And then sometime in May and June, we will be doing our annual customer feedback survey to know where the gaps are and what we can do to make improvements. With that, I'll be happy to take any questions, and thank you for the opportunity to participate remotely.
Are there any questions for Dr. Naikare? All right, I don't see any questions here. Thank you for your update and enjoy your vacation.
Thank you. Thank you.
Stephan, welcome back. Good to see you in the flesh.
Thank you. Good to be back.
Thank you again, board members, for having me. I never take it lightly to be on the agenda to give an update. I've been threatened a few times for getting kicked off, so I'm joking. I won't say who threatened me, but we all know. No, I'm joking. Totally joking. So today, pretty light outline, and so I'll give an update related to our dual path platform test, update on our CWD cooperative agreements and where you can get some of that summary data. And then talk a little bit about our deployments, a hiring update. And then I remembered as I was sitting down, I was also going to give an update on our equine NOM study, just briefly, which is probably why it ended up getting left out of the slide deck. And so one of the updates is our dual path platform test. And this is a test we use for TB testing and cervix. It's our official test. It's an antibody test. We're currently out of the test kits. They've reserved about 100 of those kits for retest. Being that we don't have a sufficient number of kits, all incoming samples are being frozen pending the restock of those tests. With the estimated delivery date of new test kits being April 20th, but we're also not quite sure about that date. And so we've experienced this, last year, we've had this issue kind of over and over again, but we like to make sure our stakeholders know. And so if folks have movements that they need to do for their herds, it's important that they consider doing the single cervical test instead. So just wanted to share that update. The next one is usually for related, so USDA provides CWD cooperative agreements annually. We've been doing this for a while now. As a part of that, we also have an annual meeting where projects are shared out, kind of the advancements of those projects. We weren't able to host a virtual CWD cooperative agreement meeting in 2026. And so they are thinking of other ways of sharing that information. And so for the 2024 funding recipient summaries, those are available. And so they're one-page summaries compiled for the 2024 funding recipients. And they're broken out in tribal nations, farm survey, and then wildlife. And so those summaries provide the accomplishments and project highlights. And so I included the QR code for folks who may want to go to the site and kind of dig in. It's also a way for USDA to not only be transparent on where these funds are going, but also build on the knowledge base that is in this area. This slide, so since I've been back, because I went on my special assignment in November. And so as I was looking at things to update the board on, I was like, oh my goodness, my folks have been doing quite a bit of deployments in different areas that folks may not be aware of. And so back in November, Will Weeby, he's an animal health technician. He did a deployment. Will is one of our 3D animal health technicians. So he's been hired into a position that's specific for 3D activities related to HPAI. And so he was deployed in South Dakota in November, and then Kelly Neeson was helping to cover the Chicago port at O'Hare. And then in November, Steve Just, you all know him, he's a field veterinarian. He serves as an incident commander on one of our incident management teams. He also serves on the Minnesota team. He, in November, went to do port coverage in Dunseith. So North Dakota has 3 land border ports, and they've been significantly understaffed. Or not staffed, I should say. And so Dr. Just went there to help cover that port. Then in December, Tina Cruiser, she's our animal identification coordinator. She's also one of 2 of our field reimbursement specialists. They're the individuals who help producers and HPI with their indemnity payments. She did a virtual deployment with Indiana. Then in February, Will deployed to both Iowa, and then March 4th through the 24th deployed to South Dakota and North Dakota for HPI. In March, which brings us up to now, Mackenzie Reberg, who's our epidemiologist, is virtually deployed for New World Screwworm. She's doing data entry, and it's related to fly dispersal and helping to track cases. And And so, and then we also have Caitlin Graylish, who was deployed to the US Virgin Islands to help with surveillance sampling for tropical bont tick. And then Dr. Just is serving as incident commander for New World Screwworm. And later in April, is helping to cover Pembina port coverage. And actually the Pembina and the March, those are the same ones I just. And so it just shows a strong Minnesota participation across HPI, New World Screwworm, port coverage, tropical. I mean, we're doing it, but so, and it's all voluntary. I don't want you guys. I mean, the need is there through USDA, and so, you know, the Minnesota folks are stepping up. We always make sure we have coverage here, though, so that's important that. But the beauty of folks helping in other places, especially when we're looking at HPI and New World Schooling, is that they're building skills. And then they're helping to decrease disease in another area, which, you know, hopefully helps us as well. So kudos to these folks for, you know, taking on this extra work and just doing that work. So I was looking at our calendar and I was like, man, I need to share this. And they actually have been, and Kelly Neeson just volunteered to do another port coverage. I mean, our ports, we're just understaffed across USDA. And so again, I'm just proud to have a team that's willing to volunteer to step in to help in this way. Additional updates I have is related to hiring. And so USDA, talking understaffed, we recently went through a hiring round that was more leadership focused. And so I think, if I'm not mistaken, we were short maybe 20, I want to say 27, but around 20 AVICs across the country. And then we were short in leadership positions, you know, all across APHIS for both veterinary services and some of our other programs. And so the recent hiring round really focused on what we call merit promotion. And so that's hiring within the agency. And so the hope was that if you're hiring, you know, AVICs within the agency, you kind of give people a chance to move seats and then open it up more broadly. So, you know, kind of, because if you open it up broadly, people still, you kind of shuffle seats and you don't gain any new people anyway. And so that was that recent hiring round. The upcoming hiring round in May, we're gonna target hiring through case exams, so it's open to everyone. And then focus on field positions across the country, so our VMOs and AHTs, which is good for us, because we have 2 VMO positions that are vacant and then two AHT positions that are vacant. And actually we have 3 AHT positions that are vacant because yesterday Mike Fear, one of our animal health technicians who's been with veterinary services in Minnesota for 29 years, retired. And so big kudos to Mike, or congratulations to him. And we hope to celebrate him more, you know, kind of a bigger celebration for such a long, great career with our agency. So he's just been a great person, and was sad to see him go. And he mentioned it earlier in March, but I was in a little bit of denial. And then, yeah, he reminded us, he was like, nope, I wasn't joking. And then the NOM study, and this was just a reminder, if you all did not remember, we were in South St. Paul, we're in Minneapolis. We've been in Minneapolis now for about 6 months or so, and it's going well. We're making do. None of our phone numbers or anything changed, so that was good. The NOM study, so usually with NOM studies, there's 2 phases. Kind of the first phase, our National Agriculture Statistics Service group helps us by calling and reaching out to producers. And then the second phase, we're usually either going on farm or we're, testing more hands-on with our Minnesota team. For the equine study, we probably won't play a part locally, but I think it's important for, I always try to mention which NOM studies are coming up because it's so important to those industries to participate in these studies because the information really feeds the knowledge base in the industry. Because sometimes there's no other way to know some of the statistics and metrics in an industry outside of the NOM study. And they help researchers also, apply for funding and kind of know where the gaps are. And so yeah. And then last but not least, just a picture of my lovely family. I don't want any short jokes. Keep them to yourself. I know both my children are. So my daughter's 10. She has me probably about, well, I still feel like I'm taller than her, but I also think I'm she's also wearing platform shoes. So whatever, and then my son obviously passed me a while ago. Anyway, any questions for it? Thank you so much.
Any questions for Stephan? All right, thank you.
Thank you.
Welcome back.
Okay, yeah.
Did you say what you did on your deployment?
Oh, yeah. Thank you for asking. So I didn't. I wasn't sure if people would be interested. So my detail was I was associate deputy administrator for our 4th unit that people don't usually think about because it's not as much stakeholder facing as our resources people services unit. So it's our unit that oversees our human resources, our training group, travel, timekeeping, fleet, because we had lost some of our senior executive service members. And so we had some leadership gaps. That position was filled in January and I was able to help transition the new ADA for that position into her position. So it was great, but it was nice for me to see behind the scenes for some of our hiring stuff so that I can kind of better support us locally. And so, yeah, it was fun. Thank you for asking.
Hello again, and to echo Stephan's or Dr. Schaefbauer's thanks, I also really appreciate having the opportunity to share the work that we're doing at the Board of Animal Health, at the Minnesota Department of Health with our board members. Just a quick agenda. I was going to spend most of my time talking about Brucella canis, considering the investigation that is going on, and also just a little bit about a salmonella associated with backyard poultry and a project that we're also doing with the board, and then just sharing some of our recent outreach events. All right, so moving on to Brucella canis. So just a little background, brucellosis is considered to be actually one of the most common zoonotic diseases in the world. It can cause acute or chronic illness by the Brucella bacteria in humans. And in the right conditions, it can persist in the environment, but it's really known as a reproductive disease, both in humans and in animals. And so there are 5 major Brucella species. And each one tends to be primarily associated with a specific species. And so, for example, but they can cross-infect. So Brucella abortus primarily affects cattle, bison, and cervids. Brucella melitensis primarily affects our small ruminants, goats, sheep, and camels. And Brucella suis infects swine, and Brucella canis infects dogs, and Brucella ovis infects sheep. Brucella melitensis has actually been eradicated from animals in the United States, but it's still endemic in many countries outside of the US, especially in Africa, Asia, and parts of Latin America. And so we actually see a fair number of travelers that are infected with Brucella melitensis when they're consuming raw dairy products. And we actually just got 2 cases this week who consumed raw camel milk in Oman. And so these 4 species have also been documented to cause illness in dogs. We do occasionally see Brucella suis associated with dogs that are taking part in feral swine hunts. But for the most part, Brucella ovis, though, is not considered to be zoonotic. And then the understanding kind of the actual bacterial morphology is kind of important to understand both the pathogenesis of these bacteria and also diagnostic testing. And so Brucella abortus, melitensis, and suis are considered to be smooth strains, whereas Brucella canis and Brucella ovis are considered rough strains. And this is really just based on a protein that is located on the outside of the cell. But that rough strain has made it difficult for diagnostics, especially both in animals and especially in people. So in humans, the incubation period for Brucella is normally anywhere from 5 days to 6 months following exposure. But again, similar to what Dr. Vista was saying with dogs, we can see long incubation periods and also recrudescence, where people have had an initial clinical syndrome and then decades later will present again with clinical signs. So for example, we had an 80-year-old gentleman who worked in a swine slaughter plant when he was in his 20s and presented in his 80s with a splenic abscess that was just loaded with Brucella. So it's a fascinating bug. It tends to evade the immune system and hide out in white blood cells and in the spleen. So initial symptoms tend to be nonspecific in people, fever, and it tends to be intermittent. So it's also known as undulant fever in folks. And muscle aches are common, chills and sweats. But again, you can have serious complications and it can lead to this a chronic illness, especially where we see infections and kind of those abscesses that will set up in people's heart valves, bone, liver, spleen, and also the testicles. So with Brucella canis, specifically, it can cause infections in humans. The symptoms tend to be very similar to other Brucella species, and we do see serious manifestations, but again, can be mild or asymptomatic as well. And it may be self-limiting, and it's usually spread through an oral nasal route. But one of the most important things to know about Brucella canis in people is that it's very difficult to test. There is not an antibody test for people, and really the only way to diagnose it is through a blood culture, which is pretty invasive because you essentially have to collect a large amount of blood and then culture that. And so you need an astute clinician to consider Brucella on their differential. The epidemiology is also poorly understood. There have been a couple seroprevalence studies using non-approved tests, trying to look at seroprevalence in people who have exposure to dogs. And one study estimated that there was a 3.6% seroprevalence, especially associated with people who breed dogs. There was a literature review that identified 68 human cases from the 1960s through 2012. Most of these folks had mild symptoms, but there were some severe complications. 80% of them were linked to canine exposure, but Brucella can also be transmitted within the laboratory setting if people are not taking the appropriate precautions especially with cultures. And so there was 20% that were also linked to lab exposure. And there was an outbreak on the East Coast that involves 6 people from 3 different families that were exposed to puppies from 1 infected litter. And so here in Minnesota, this chart just shows the number of human brucella cases that we see every year. We tend to average about 2 to 4 cases per year. Again, we need those clinical isolates sent to our lab in order to diagnose those. And so we really are relying on those astute clinicians who are getting the background on their patients, because it is such a non-specific illness to actually test. And we've had essentially only 1 confirmed Brucella canis case in Minnesota. And this was a dog breeder who tested positive in 2002. And so because it's rare, this makes our messaging a little difficult to our owners who have positive dogs, because we don't have a lot of cases that we can relate to, but we really feel strongly that it's likely underdiagnosed. And so, as I mentioned earlier, Brucella canis is one of the programs that we work very closely into collaborative surveillance for with the Board of Animal Health. And so our goals when we have these conversations with owners are essentially to reiterate the messages that the Board of Animal Health has already had with the owners, and then discuss those folks that are at highest risk for serious complications. So that includes pregnant women, children, elderly, and those folks that are immunocompromised. And we also assess their exposures and then provide recommendations for testing based on their exposures and any clinical symptoms that they may report to us. And so our current recommendations for human testing are essentially anyone who has reported having contact with bodily fluids from an infected dog and who may have symptoms compatible with brucellosis. We refer them to their healthcare provider, and then in consultation with their healthcare provider, will do additional testing. But people who have lived with, who have been exposed to an infected animal but do not have any compatible symptoms, we do not recommend testing or treatment. There's no prophylaxis that we would recommend. And we ask them to do symptom monitoring and give us a call, or their healthcare provider a call, if they develop any symptoms. We also reach out to the veterinarians that are involved as well, because many times these dogs have had repeated veterinary exposure as they're trying to diagnose what's going on with them. And just reiterate, especially for those dogs as well that are in lifetime quarantine, that it's really, really important to isolate them from all other dogs. Consider your scheduling as to when you're bringing these animals in. Consider bringing them in at the end of the day when there's no other clients. Avoid letting the dogs urinate in the clinic if possible. Again, just kind of reiterating the things that the Board of Animal Health has already discussed. And then talk about the personal protective equipment that veterinarians should be wearing. So we do recommend gloves, depending on the types of procedures that you may be doing. There may be a need for an N95 if you're having aerosol generating procedures. Important to have eye protection and waterproof gown and coveralls and shoe covers. And good hand hygiene is always really important. And then really limit your staff and prevent contact with folks that are at risk, especially if you have any pregnant technicians or veterinarians there. And then we also work with Dr. Cavisto's group to also do education and provide resources to clients and rescue groups regarding the zoonotic potential and risk mitigation. And so we have a combined fact sheet that we share, and that is on both of our websites. And then just offering advice on what PPE to wear if you're well-being puppies and you don't know the background of the mother, and ensuring that there's no contact with other dogs until they're tested, and really helping these groups identify who are the highest risk people that should not be interacting with dogs that you don't have a good idea of what their background is. So that's a little background on our approach to canine brucellosis. And then I'll just quickly talk about Salmonella and backyard flax. And so we see salmonella cases and outbreaks associated with backyard poultry every year. I think we've talked about this several times. But the cases are predominantly female and tend to kind of fall on the either sides of the age group. They tend to either be young children under the age of 5 or older adults. Most of them in Minnesota here live in rural counties and have reported purchasing chicks that season. And so since 2023, we've been working in collaboration with our Board of Animal Health partners, the University of Minnesota as well, to collect chick papers to identify serotypes that are associated with baby chicks, because many of these salmonella serotypes are also associated with chicken exposure as well. And so we're just trying to kind of work through the salmonella quagmire to assign associated appropriate attribution. And we actually just published a paper in collaboration with several other states on this kind of One Health approach to help identify public health actions due to this outbreak and backyard poultry exposure in January. This one came out. And so this year we're again partnering with our public health lab and the Board of Animal Health and the University of Minnesota. I believe we've enrolled 8 feed stores, and we'll be collecting papers, chick papers, essentially that the chicks are shipped to for salmonella. So Dr. Tim Johnson's lab will be doing those isolation, and then those isolates will be sent to the public health lab for whole genome sequencing. And so this is just the kind of our recruitment sheet, just letting the feed stores know kind of what we found last year. So we did find 3 different salmonella strains that were associated with human cases based on our chick sampling. That's where it was identified. And then those salmonella serotypes were able to be linked back to human cases that were reported through public health surveillance. And the goal is that this is there's nothing that the feed stores are doing wrong. They, and the CDC then shares this information when they make these connections back to the specific hatcheries. So the whole goal is to get that information to them as early in the season. So if there is a certain, breed of chicken that or poultry that seems to have a salmonella issue, they can work back to their hatcheries as well. And then finally, just some awareness and outreach events that we've done. So in March, we had 2 trainings. The first one, we do a training for law enforcement. And so we held one in Anoka that had 10 different community or 10 different police departments and their community officers coming, where we just talked about dog bites and rabies risks and when we need to be concerned about rabies, and also helping them kind of understand when we may reach out if we have a dog bite situation. And most importantly, how to appropriately euthanize an animal so that we can test them for rabies. And so we try to do these trainings as much as possible just to make sure that we have samples that we can be able to test, and that the law enforcement know who to call if they have any concerns about rabies. And then just last week, we held our agritourism workshop in Rosemont with 16 different organizations coming in to essentially learn about how to safely have agritourism. We do this in collaboration with the Department of Agriculture and our environmental health division, as well as the health department, so that folks can learn what appropriate licensing is needed if you're serving food. And then our group talks about enteric illness and the risks of having human and animal interaction and how you can do that more safely. And that is all I have. Happy to take any questions.
Any questions for Stacy? Go ahead.
For the salmonella chick paper, the flyer, the 3 serotypes, those are Minnesota specific?
Yeah, so in Minnesota, it's a national outbreak because these chicks are distributed, across the country. But essentially, the chick paper sampling that we had done last year, there were 3 serotypes that we were able to identify that were identical by whole genome sequencing in human cases. And so then that the exposure information is then able to be given back to the hatcheries. And that's all kind of done through our federal partners because they're not in Minnesota.
Yeah, I was just curious, because you said the project was a national, so I was curious whether you were giving Minnesota specific data back to the dealer, you know, as you were doing outreach. So
Yeah.
it sounds like you are.
Yeah, and in 2023, that was a multi-state project. And I believe there are still 3 states that are doing this type of testing. But we don't receive any funding for this project, so it's really on the goodwill of kind of everyone involved to keep going. But Dr. Johnson is graciously provided his services to do the initial isolation. And he's been incredibly successful and has actually shared his protocol with many other states because the first year, I think most of the states had very little success because they were swabbing, whereas he does an enrichment of the actual papers. So he's soaking like 500 mils of enrichment fluid. And so we were able to isolate exponentially more salmonella than anyone.
I feel it's my duty to ask you to remind everyone what the circumstances of the cheese outbreak were, so that they're not fearful of going to the store and buying, not on salmonella, on brucellosis, the cheese outbreak of 2020.
Oh, yes,
Since it
sorry.
said cheese, I want everyone to calm down.
Yeah, no, absolutely. So the cheese outbreak was actually associated with illegally imported queso fresco coming
Front go.
west. So, and it was actually being sold on the street corner and being kind of hand delivered. So there was many regulatory actions that were being ignored in that situation.
Cheese.
Absolutely not associated with any environmental process.
Right.
Quick question. So those dogs that have been coming from the reservation out in South Dakota, are those strays or are they coming from a house? And if it's come from a house, are those people getting tested as well?
That is a great question. And our interview process are for essentially the people who adopted the dogs in Minnesota. And so we're getting that contact information from Dr. Cavisto's group. I'm not aware of what is happening in South Dakota.
Okay.
I know that their state public health veterinarian has been involved in the past in these types of situations, but I don't know specifically what type of follow-up they do with those dogs. I don't know.
Stray dogs, they were a major stray dog population issue on a particular reservation, and there's one of the few studies really brucellosis in stray dogs, and when they compare it just anecdotally to across the country stray dog population, so typical southern states stray dogs 6 to 8% might test positive. On this particular reservation, accounting for error and whatnot, they estimate more like 29 to 30% of the dogs. So it's significant. But yeah, I've heard upwards of 4,000 or 5,000 stray dogs on the reservation.
Can you say that number louder?
The number of stray
The
dogs.
number of stray dogs?
I've heard numbers of like 4,000 to 5,000. If you go, there's a rescue called Lightshine that specifically works with this reservation. And on their website, she has a lot of data on the number of dogs and what they've done. They test a lot and they euthanize a lot that come up positive. So they're doing what they can at that point. So they know there's a problem. They're trying to do something about it. But the numbers are staggering.
Any other questions for Stacy? All right, thank you for your update.
No, I.
No.
We need a little lip right here, that would be nice. All right, well, I'll go ahead and get started. So I'll start with my slide from the last time I was here here presenting at the board meeting was our September board meeting. So we were in the start of a new biennium. Fiscal year 2026 had started 7/1/2025. As we can see here, chapter 34 granted the board in 2026, $6,675,000 for the year. And then in fiscal year 27, $6,800,000. And that does include the operating adjustments of $265,000 for our first year in 26, and then $390,000 in 2027. And that is to maintain the current level of service delivery. So just a reminder, that's kind of where we were at in summer, fall. So now over here in spring 2026, it is the fourth quarter of the fiscal year. So we are very much in a positive outlook as we are headed towards year end. We were in a completely different spot. If you remember last year, April, we were canceling contracts, kind of in a bind of what we were going to do with our budget with some of that cooperative agreement funding kind of in lieu of what was happening with everything. So fiscal year end, as a reminder, is June 30th. So kind of my team is scrambling to make sure that all of our invoices are paid for the year, that our budgeting and accounting is all set up for the new year and 7/1. Something I've coined is spring cooperative agreements. I just coined it spring cooperative agreements because they start April 1st historically. So some of those agreements that just recently came through were Umbrella, which is our surveillance activities kind of cooperative agreement that we have, traceability agreement, and then US SHIP agreement. So that's Swine Health Improvement Plan. So those all came in and they actually start today. So new agreements in place. Most of them are in pre-award status. Which means that we are just pending kind of doing the formality of the agreements through the USDA EZ-Fed system. So just sort of waiting to get that completed, but we do have the availability to use some of those funds right away. So like I mentioned, the start date of those cooperative agreements are April 1st, and then they go through an entire year to 2027, March 31st. All right. So I kind of put together in order kind of what our budget looks like. I've had a couple people ask kind of over the year of can you give me an example of some of those costs that we're seeing? So obviously you'll see here the three that are highlighted, those are our major expenses. Those are kind of the pain points that I feel like I reiterate every board meeting that we're seeing our highest expenditures. So salary being our main expense, it takes up, I think the last time I did the pie chart, it was over 72% of our budget. And just a reminder, we are talking just our general appropriation. So that's not talking about our federal funding or our small amount of restricted special revenue. Then we get into our information technology, which we'll hear a lot of us talk about Minute. That is the agency that is deemed to take care of all of our IT, manage our software, and get us our equipment and manage that equipment. Professional technical services, our outside vendors, our contractors, of that 500,000 or over 500,000, most of that is going to our testing contracts with the University of Minnesota. So it's going to be our poultry testing, CWD testing, and sometimes some random miscellaneous testing. We also have a small contract with the University of Wisconsin for some of that CWD ELISA testing. Space rental and utilities, so that's kind of straightforward. That is our Freeman St. Paul building lease. Quite a big expenditure there and kind of some of those maintenance costs that come along with being a tenant of that building. Then we get down into travel, in-state, and fleet expense. You'll see that that's a lot higher than our travel out of state. I like to remind people that our in-state travel budget and our fleet expense are combined. So we do have a number of vehicles, I think off the top of my head,
our fleet coordinator, let us know we have 6 vehicles. And then with the onboarding with the new vet, we have another one on order. So we do see quite of expense, but we need to make sure that our field vets can get around the state of Minnesota and our ag advisors and whatnot. Other operating costs, which is a good one to bring up because people have asked, what is other operating costs? That's going to be some of our trainings that we put on. So you referred to our BCT, and so for some of that rental space, insurances that we have, unemployment costs, unemployment insurance costs, caterings for some of these events, and then service and recognition awards kind of fall under there. So that's what we see. As far as communications, you'll see that that's 39,000. We're looking at like our Verizon bill, our printing, which is kind of under there, and then we have a printing section. But some of our handbooks that we print, that will be in there. And then when you see the printing at the bottom, that's actually for more of the big machines that we have at the board. So the actual big printing machines in our contract with Metro to have those. Supplies, travel out of state, those are when we get down to what we would call our smaller expenses, and then employee development. One thing I would like to mention, just with a tight budget, is that in years past, we've seen our employee development. That's going to be some of our trainings through the state. What we have gained, I suppose, guidance from Minnesota Management and Budget is that they would like us to see higher employee development costs, meaning that they want to see us taking more trainings, utilizing that funding. However, in years past, I would say that there has just been a limited number of extra funds to be able to send more of our folks to these trainings. So it's not that we don't want to, it's just being able to increase that budget with the pressure of reducing expenses kind of hard to do. Is there any initial questions on this or examples? I know I've had people just ask about it and kind of these different descriptions and categories.
Does training include like conferences, or does it just include like state put on trainings, or?
You're talking about that employee development?
Yeah.
Yeah, more state trainings, specifically to MMB's kind of ELM catalog, and some of that. Right, I will continue on. All right, some of our federal funding cooperative agreements. So like I mentioned, the top 3, what I've coined our spring cooperative agreements, are in place. We also have our HPAI emergency response for poultry cooperative agreement. And then H5N1 in livestock, that actually ends here September 2026. And we were fortunate as an agency that we actually didn't need to utilize any of that funding. That funding is specific to how we can use it, as far as salary, supplies, travel, all that sort of stuff. And by the time that we actually got this cooperative agreement in place, and an agreement in place, we did not have the need to use that cooperative agreement. So that was quite a large cooperative agreement. I believe in total it was 300,000. And we did not actually have to utilize those funds. So good in the sense USDA did not have to reimburse us for anything, and that we were in a good spot to not have to use those funds. And then also we have 2 CWD agreements. One is mainly for the potential for indemnity that would need to be paid to reduce producers. I can't speak for Dr. D'Amico, but we also have another CWD one that is for herd management. And so I know Dr. D'Amico's team has been working to utilize some of those funds for some of her staff and herself. All right, so kind of a whole bunch of topics on this page, but as I mentioned, we are in the 4th quarter of fiscal year 26. So really between March till May, we're really in that planning stage of what does the new year look like? What are we trying to do? What are we trying to set up and account for? Our general appropriation, like I mentioned, is that 6.8 million for fiscal year 27. We did get that grants operating adjustment of 390,000. However, we are going to see our salary expense go up by 1.75. That is typically a little bit lower than what we planned for. But what I can say is that we also have other contract increases, and when we combine those, it's equaling a little bit over to near that 390. So we got that operating adjustment. However, we're seeing some of these expenditures kind of equal out with that operating adjustment. So sometimes it doesn't feel like we really gained extra. And then as usual and per usual, I feel like I'm on repeat when I say this, but IT costs are going up. Our partner over at Minute, Laura Velasquez, let us know that they're planning for a 5%, 5 to 6% increase in costs. So that's our software, equipment, so all of our laptops and labor with that. And then generally just the labor that our agencies support. Most of Minute's salaries are supported by agencies of the state, so they don't get a lot of funding from legislators. That funding is usually brought on from other agencies. So with our crew that we utilize, or I should say work with the most at Minute right now, which we call our at-agency crew, their salaries are mainly supported by the board, Department of Agriculture, and then DLI. And so we'll see an increase there. So also when I'm talking about that 1.75 cost of living adjustment and other contract increases, that's also going to be an increase for Minute staff as well, as they are state employees. One piece of good news and something I'm actually excited to talk about quickly is that our St. Paul office space, it was deemed one of the most expensive places to rent on the Capitol complex. As of fiscal year 27, admin actually owns the building. And so they are able to bring down the cost of the square footage or per square foot. So we were paying here in fiscal year 26, $31.90 per square foot. In fiscal year 27, we are going to see that be reduced to $24.90. So calculating that over $40,000 that we're going to save in our space budget. Like I said, it's probably going to get eaten up by the salary expense and some of that Minute expense, but still doing the task of reducing expense. And then efforts to continue to reduce expense. I know I mentioned this in September's meeting, but the state of Minnesota continues to plan for a deficit in fiscal years 28 and 29. I do know that there has been some improved outlooks with more revenue coming through. However, that was kind of that outlook was proposed right before all of this fraud stuff came out. So I know there's a lot of hiring for some of the fraud situations. And so I don't know if that has another effect on this improved outlook. So still planning for that deficit, which is going to make it hard for us to plead our case for a new biennium when we're looking to get more funding. However, we are kind of in the idea / brainstorming phase right now of how to continue to reduce expense, but also be able to continue to produce our deliverables for everybody. So I think we have a couple ideas sort of, like I said, in that idea stage, and I'm hoping that fall 2026 we'll have more concrete ideas to deliver and share with board members. All right, I think my next slide is going to go into more hiring. So should I take any questions that are talking about budget at this point before I dive into hiring?
Just the fact that costs are going up, maybe.
Well, I think relatively that's everywhere and every household, every agency, every company. It's the theme for everything right now. It seems like the cost of everything is going up, but not necessarily for us at the agency getting those funds to cover that cost. It's kind of like, hey, costs are going up, but please keep delivering the same service delivery that you've been doing. And it gets to a point where it's like, okay, there's just no more money to cover said things. And so it's been a predicament.
I have a quick question. The Minute, it sounds like most agencies use that company, that service. Is that the only option?
Yeah, I believe there's statute language, and I don't have that all agencies need to procure all of their IT with that state agency. And so they do limit agencies on kind of getting outside information technology.
Yeah, it's 100% a statutory requirement.
There, we got Andrew over there.
Thanks,
I
Andrew.
don't have it memorized.
Unfortunately, it's been a complaint, right? Because it kind of feels like a monopoly. They set the prices, they set what we are expected to pay for labor. And it's been a pain point for our budget for sure. But what were you gonna say, Brian?
Somewhat in their defense, so they don't receive any state appropriations, so they fund their agency through us. They aren't receiving anything from the legislature, so in their defense, they're charging according to what they need to keep the lights on for their agency too.
Right.
Any other questions?
All right, I will go into a quick hiring update. So Dr. Susan McClanahan retired December 2025. She was with the board for quite a few years. We do have a replacement for her, Dr. Melissa Knudsen. She is scheduled to start May 11th, so we are kind of deeming that the board is being taken over by Melissa's. I'm Melissa, we got Missy Savigny as Melissa, and then now Melissa Knudsen. She did agree though in some of our onboarding calls that she would be called Mel. So we have Mel, Missy, Melissa, so we will welcome her May 11th. And then another big loss to the board was Carissa Allen. She was our data management supervisor, or better known as the guru of Core One, Traceverse, eCVI Central. She resigned in March 2026. One thing about her position, being the data management guru, is that we found, looking at her position description, after her working in the position for so many years, is that it really needs to be reworked and re-understood to be able to bring in a qualified person to really be able to take this on. She was really at as far as I understand, the infant stages of all of our data, intimately knowing all the programs for so many years. And I believe she actually did field work, if I'm correct, early in her career. So she really got to know everybody intimately. She got to know the needs for all of data management very intimately. So it's going to be quite the position to fill. I can already imagine the person coming on feeling very overwhelmed, but that's why we're looking to find a very qualified person to come in and take that on. I think we'll also, if you didn't know this about Carissa's position, utilize this person to sort of be a minute mediate, to work between minute and sort of some of those issues, to understand some of our IT stuff. I know when we talk about servers and stuff that kind of goes way above my head, she did a lot of that work for the board to understand what the needs were from a minute aspect, and then relating that back to us kind of in a general aspect for the agency to understand. So they will work as sort of a minute liaison for us as well. And then also Nancy Reek, she is our state program admin for the livestock concentration points in our cattle division. She is retiring. I don't know why I put April 4th. That's supposed to say April 2nd, but tomorrow. So she has been with the board for quite a few years as well. She's looking to retire, and she will also have big shoes to fill. So preparing both of those job postings. Once they are finalized, I will email that out to staff and then board members as well. I think that's all I have.
Just
So
a
if you have any
fun fact about Carissa's position. So she's leaving us to go join Traceverse, who is the parent company for Core One. So we still have access to her.
Yeah, she'll still be able to be utilized, and she has said many times that she would probably be working with us in that space in her new role, so.
I do have a question.
Yeah.
Backing up a little bit, I was just processing after Erica's question. So with the minute, if they get paid from the agency, but not by not legislatively, what checks and balances are that they can't just be like 20% this year, like what, if that's not top down to say like, nope, you gotta work within your budget. Like where's the checks and balances for that?
Yeah, so I mean, are you talking about for their labor or as far as?
Oh, just cause like, it seems like each time that's pretty big, and I've heard that in like from other, just even like legislative hearings and stuff, it's like, well, a minute costs a minute, whatever. So I'm just wondering, you know, obviously, like, we could say like, hey, we need more money. But if the legislature says there isn't more money, then we gotta figure it out, right? But so if they can say just to the agencies directly, the costs are going up 10%. Like, what is it that?
Yeah, so there is a lot of like Office of State Procurement policy that states like, hey, if equipment, software goes up by 10%, that additional hands need to be put on that to make sure, why is this going up 10%? What is driving that? And being able to document that, because us as an agency who's paying for, you know, supposedly this now 10% increase or higher, we want to be able to justify why did these costs go up. So Minute has to provide explanation for most of those things because of the policy through state procurement. As far as labor goes though, most of that we are able to compare to their job class, and we are readily available to look at, you know, what does this person get paid through the state, and be able to compare that, you know, they weren't trying to upcharge us for some of their project management costs or something like that.
Any other questions from Melissa?
All right, well, I believe it's lunchtime. They always put me right before lunch, so I hope everybody's hungry.
All right, thank you. We'll break for lunch and start in 30 minutes.
A wide variety of entities are eligible to submit proposals. Not only state agencies, but universities are eligible, AVMA, approved organizations, tribes. There is a sister group for the labs, for the non-labs, so they're not included in this one. And every year, the NDPRP group sets priorities, and these priorities are generally things like biosecurity, 3D work, outreach, planning, exercising, training, those things. They also try to move the needle a little bit on some more underfunded or underrepresented areas like aquatic animals, equines, traceability, goat and sheep vaccine. So they do have a pretty broad breadth. And just this is one of our maps of the US. So you can see Minnesota, we've gotten 20 projects since the inception of the program, worth $5.23 million. So that's quite a bit coming to our state. The first one that we've got going on right now are some foreign animal disease workshops, working with county emergency managers. This project involved hiring a consultant team to build and facilitate a workshop series. They actually have one more to go. It's scheduled for tomorrow in Alexandria. If you'd like to catch it live, you can probably follow Eric's tail lights to get out there and the not so nice weather. So the old adage is that every emergency is local, and that's what county emergency managers really work off of. There are some exceptions to that, and one of those exceptions is foreign animal disease response, which of course is led at the state level. So we wanted to open up some dialogue with county emergency managers about what foreign animal diseases are, kind of what the response basics are that we look for in Minnesota, how we can interface with the counties and what they can bring to a response, and how we can make that relationship stronger. So they have a kind of an overview of the work that we're doing, and end up the session with a couple of scenarios and exercise on these task cards. Like, what if the state asked you for this? What if we asked you for something like that? So kind of an interactive end to the day. So that one is just about ready to wrap up. Another one that is not quite underway. We've gotten started a little bit on this one. This is more outreach to livestock markets and how a foreign animal disease response or outbreak will affect livestock markets. It's kind of one of those areas that doesn't get a lot of attention, but we've identified that gap in planning around those markets and wanted to make sure that, that we're incorporating everything we need. So we're not getting surprises when there is an event and livestock markets are involved, either, as an infected farm or inside a control area. So we're trying to establish some outreach with those markets and talking about what foreign animal diseases are, what their risk is, what the restrictions might be, how the 72-hour standstill might affect them. In a system where it's people are moving, animals are moving in and out constantly, it's not easy to think about what would happen if everything comes to an abrupt stop. So wanting to make sure that our market operators are aware of us, how we operate in an outbreak, and that we can plan together. So we're still in the plan writing phase of this project. The workshops with the markets are planned for a little bit later this year. Another one of the projects that's happening right now is some continuing education for our compost subject matter experts. We do have 2 or 3 compost SMEs here at the board. They have taken very good care of us and they are very good at what they do. One of the reasons why they're so successful is that they have been able to train folks in the industry, folks at companies, other contractors about how to make a good compost pile right from the beginning. So we don't have to do a lot of redos and retests. So there is a 3-day classroom workshop that the board sponsored several years ago. I think it was 2023, and we had about 24 folks from across the state participate in that classroom. So with the classroom coursework, you get like what they would call a junior SME status. But to get to that senior level, you would have to work with another senior SME for 2 weeks during a response. Well, what happens when there's no response? How do we maintain skills, get skills, maintain experience? We want people to be not only skilled and experienced, but also confident that they can do this on their own. And we want to be prepared rather than just kind of like lining up new SMEs when there is a disaster. So this project is meant to gather a broad range of resources and materials covering all of the competencies required for this work. And there is an incredible amount of information out there. It's just in a bunch of different places. So we're putting it all in one place and working with some folks at the U here. We've got 2 extension educators and 1 grad student with really good experience composting. She's got some composting projects of her own, working on kind of incorporating all those various competencies into an online learning module. So this will take the form of what's similar to be a 2-credit course here at the U, where we can enroll the folks. We're targeting those people who took that 3-day class, who already have those basics. Again, that's 4 years ago. So a little bit of a refresher opportunity, and then being able to build on that through the online course, and also offering some real life work, trying to work with some of the companies, the producers here in Minnesota who may run carcass composting operations, who may have, a barn fire comes up or something comes up that we have to dispose of large numbers of carcasses, and being able to take this group out and have them direct the operations to make sure that they know and are comfortable with the process and able to do this on their own. So even though, like an industry person might not be able to certify their own piles during a response, but they'll be able to take the pressure off the state resources by already knowing how to do the work, how to take temperature, how to build a pile, take temperatures, and put all that together for our responders. And then kind of the last thing I have down here is build this composting community. It's a small group, but I think our Board of Animal Health seniors will tell you that it's pretty important to have these skills to know how to handle mortalities at a moment's notice. So that is another one. I'm getting tired just listing these out, but we've got a lot of these projects going. This project, using our certified swine sample collectors in a foreign animal disease response, this is based off a previous NADPREP project awarded to Iowa State. They came up with the certified swine sample collectors program, which is basically training on-farm staff to take samples during an outbreak. So we don't have to send state or federal folks out there to take samples and maintain some biosecurity there on the farm.
Training for sampling for which diseases and swine?
This is for swine for ASF primarily. ASF, CSF, and FMD are under the umbrella. There is, and I didn't put that link on here, but you can just Google certified swine sample collectors. There's a plethora of information about the different sample types. But what I was curious about was, now that we've got over 400 of these trained people here on our farms in Minnesota, what do we do with them? How is our incident management team working with these? How do we talk to them? How do we mobilize them? How do we tell them that they're in a control area, that they need to start taking samples, at what frequency? We have a lot of experience with this on the poultry side. Krista's taken us from A to Z on that project, and we're hoping to, with this workshop and drill, to take some of those lessons from poultry side and see what we can transfer over to swine, and be able to make this a successful integration between the response team and the on-farm teams. So we'll have this workshop in July, and then a drill will be done in the fall, where we're going to, assign the farms, the samplers. You need to sample so many animals, and actually, provide the materials to box it up and ship it in to the VDL. So working with Dr. Naikare at the VDL to receive those samples. They're not going to run any of them, but they are going to be making sure that people are filling out sample submission forms correctly, packaging is done correctly, and the samples are received they're in the right temperature and right packaging so that they can be run. So kind of a little graded exercise for the samplers.
So I'd like to comment on that.
Yeah.
Most of these folks are associated with swine companies or family farms, large family farms and things, because they won't be going from one farm to another, right? And so I think through the National Pork Board and the Minnesota Pork Board and the American Association of Swine Veterinarians, everybody will know almost immediately that things are going to happen.
Yes.
Right? And
yes,
so
I'm sure.
I know you're asking all those questions, but yeah.
And so exactly. So they know something is happening.
Right.
And then at what time do we pick, when is your farm coming up? When do you need to actually start taking samples? Or are we asking people to take surveillance samples statewide? Those sorts of things. Really trying to draw that connection between that on-farm work and the response. So, and the veterinarians, because all of these sample collectors are working under the umbrella of an accredited veterinarian. So a lot of people in the mix, a lot of chances for information to get crossways. So we want to make sure that we have a plan for how to roll this out smoothly. Yeah, this is this is a project, the certified swine sample collectors are endorsed by a US ship. And so it's become like a real thing in the industry, and we're really happy. That's why we have so many of them already signed up. So it's kind of just using that as a launching pad to get to the next section, the next level, I guess, of the response. And we'll be able to help other states once we have something laid out that we can share with other states that they can use for similar issues. And then the final project that I wanted to talk about today is the one that's gotten, I guess, most of the work done already. We're pretty far through this project. You might have heard of it already, the nitrogen whole house gassing for poultry. This is a project kind of trying to optimize our systems so we can use this as a depopulation method for emergency purposes, and make sure that we know the technical necessities of using nitrogen to displace the oxygen air in a barn and put down the birds quickly and humanely for an outbreak. So this project uses nitrogen. We've been interested in nitrogen for a while here in Minnesota. We've done some other nitrogen projects with swine, specifically nitrogen-filled foam with swine. So this is kind of the cousin of a project like that. This is just using, actually, forget all this, the foam, all the other stuff. We're using just liquid nitrogen and putting liquid nitrogen, letting it vaporize into a barn. Very low equipment needs. Nitrogen has kind of worked its way up on the ladder of interest, I guess, in the last few years. It's getting more people's attention. It leads to anoxia for the animals, puts them down fairly quickly. It's less aversive than CO2. So when we're talking about welfare situations where people like nitrogen better than CO2, it is, we forget that the rest of the world in a high pest situation, the US, I think we might be the only country who uses foam. The other countries have deemed that to be inhumane. So kind of looking at what other countries, the EU, Canada, are developing and wanting to maintain that, kind of those welfare scores in the upper levels. And then also, when we have done this, we've tried this before with CO2, filling a barn with CO2. There's a lot of safety issues, a lot of issues just getting enough CO2 for that. Got a lot of CO2 depopulation methods for swine, but we got the equipment, but it's really hard to get the gas. So nitrogen is much more available. I'm not going to go through this too much, but suffice to say that this method was developed in Italy and kind of traversed the European world and then landed in Canada a couple of years ago. The Canadians have been doing an extraordinary amount of work perfecting the system. I think we just finished our 5th trial, but it was the 61st trial here in North America. So they've been doing quite a bit of work north of the border. We've got this group here, Livestock Welfare Strategies. This is the group that has all the equipment. They are going into Canada. They're doing all the work in Canada and the US. So we are working with them. Currently, they own all of the equipment and they have all the expertise. So also working with a familiar face there, Dr. Marie Culhane. She's staying on after retirement and able to help us out quite a bit. So I mentioned we use the liquefied nitrogen. It's a little bit different than sending liquid through a vaporizer. We just don't have that middle step and send it right into the barn. We have had some issues with CO2 where companies say, sure, we'll sell you CO2, but what are you using it for? We don't really want to be associated with killing animals. So we made a point with this project to do some work on the front end, let them know what the project was all about, make sure that the companies are okay being involved in something like this. So that was kind of building off a lesson learned from before. This is some of the equipment that we use. We have a custom built manifold with flow meters on each of the hoses. We've got a couple different options for hoses that we can use in different situations. And we've been using our West Central Environmental Consulting for our barn sealing crews. They are also our HPAI depot crews, so they're quite familiar with birds. I think this is the first time they've been into egg layer housing though, but they have gotten, some quick and dirty instructions from the Canadian groups that have done this before and are bringing all of the appropriate tape, plastic, sandbags, insulation, lumber, plywood, all of the materials to these barns. They are in charge of finding all of the holes in a barn and sealing them up appropriately. So they're looking at the doors and the fans, and some of these barns are newer and built quite tight, which is real easy. And sometimes they've got some hidden vents and things that give us a run for our money when it comes to sealing them up. And then on the inside of the barn, we have a series of these environmental monitoring units. You can see that little yellow Pelican case there. That is a custom built piece of equipment with 3 probes coming out of it. We put the probes at various levels on the cages. So if you think back to kind of your high school physics and fluid dynamics, we treat that the nitrogen filling the barn as a fluid, and we can watch the waves come through the barn through our probes. We're looking for oxygen levels, temperature. Remember, liquid nitrogen is minus 385 degrees. So we want to make sure that we're not freezing. We are not allowed to freeze any birds for welfare purposes. So we take pretty close care to make sure those temperatures are staying in range. We also look at relative humidity and barn overpressure. We're adding stuff to the inside of the barn. We don't want it to get too pressurized in there. So those in barn units kind of relay wirelessly back to our command trailer, and we're able to read in real time. We can see where the nitrogen is in the barn. Generally put 4 of these in each barn, the 4 corners. And we also, as a backup, we have just a regular old-fashioned drag or air sampling tubes that we run into the barn to collect air at the ceiling height, making sure that we're completely filling the barn. So we've got a couple different environmental monitoring systems in use. And we're also looking at individual birds. Like I said, we want to make sure that the birds have lost posture before they get too cold. Thank you. And we actually implant them with 2 data loggers on either side of the keel. They track the heart rate, body temperature, and kind of like a Fitbit type thing. They look at body positioning. So we've been working with Star Odie, the manufacturer, to develop kind of an AI system to read. It's a lot of data that's coming out through these data loggers. So we want to be able to quickly read and interpret that output. So we get 15 individuals per barn. They get surgically implanted the day prior, and then we do a welfare check before we introduce the gas. Here's just a peek at the command trailer. Got a lot of hoses and wires coming out to it, but the important thing is that we have closed circuit cameras inside the barn. We place those near our birds and try to get them near the gas outlets, near the environmental monitoring, kind of have like little clumps of equipment in a couple of spots in the barn. So we can actually see what the bird behavior is. We've got Dr. Culhane and usually the farm veterinarian will come and sit and watch and monitor the behavior of the birds as we go through the process. The birds typically don't react until we get down to about, we start again at 5% oxygen, 20% oxygen. And by the time we get down to about 5%, 3 to 5% is when we really see the most activity. Generally, the birds just kind of settle down and then lose posture as they lose consciousness. So we're able to look at that. We're looking for any distressing behaviors, any escape attempts, those types of things. So recording those things from our view into the barn. And then after every trial, we get a little report that covers, kind of matches up the environmental monitoring, the implant devices, and then our operational report, kind of how much gas we're flowing into the barn at one time. So kind of tying the whole thing together. And like I mentioned, we've done 5 of these trials. We've got 2 or 3 more to do before August. So we're still looking for another couple of host farms to help us out with these. We have learned that even though as much work we did with the gas companies on the front end, nobody ever seems to tell the driver what we're doing. So trying to make a little manual or a cheat sheet for each driver that we can just give when they pull up. And usually they haven't gotten any previous information on it. So kind of shortening that dotted line for information. And then also, no matter who you talk to, it's always best to ground to truth your houses. There's just a vast range of house styles and setups and interior equipment. So we really have to kind of see it on the ground before we make our decisions. Sometimes we have to make real last minute decisions to get these barns set up correctly. So that's just a nutshell of all of the projects we have going on. And then sometimes Dr. Hoefs gives us more stuff to do with new exercises. So we are keeping busy. We're keeping the whole team busy and working with the board individuals as we go along. So kind of building a real partnership amongst us with all these different projects and also able to share the results with our colleagues in other states. Is kind of the big reason why NDPRP succeeds, is that we are able to share those results and have everybody able to learn from the work done in Minnesota. So thanks. Any questions? Questions. All right, thank you.
Thank you.
All right, I know we're behind schedule, so I'm gonna try to keep this short and sweet. A couple of the topics that I wanted to just mention to you was kind of our CPU of the day. We have to mention HiPal. I want to talk a little bit about our poultry dealers and that poultry dealer program. And then just end up with a quick update on NPIP. So since we last met, we haven't had any new cases, so we're celebrating that. So that number is the same as it was the last time we were together. So that's good news. But it is not the case everywhere in the United States and some states, especially to our southeast, have really been hit hard. Indiana, Pennsylvania in particular. And so these numbers are just from within the last 30 days, and it was pulled yesterday off the USDA website. So we've got 37 commercial flocks and 31 backyard flocks. And the two maps there, the map on the upper left is our commercial flock site. So you can see Indiana is just like lit up there. And then the one on the left is backyard, and you cannot see the colors, can you? There's like all of these states kind of through here, our backyard flocks. I'm not sure why that's not showing up well. So it's around us, and I'm hoping that doesn't mean that it's coming towards us. But I think time will tell. We're certainly not out of the woods yet with spring migration. But I just wanted to mention, if you look at just Indiana alone, these numbers are terrifying. So I pulled this off of their Board of Animal Health, Indiana State Board of Animal Health website. These are all the cases in March. I think I counted, it was like 33, 34, it's a lot of cases. And I think it's worth mentioning, because we certainly don't want to see that hit Minnesota. Indiana's got a different makeup of their poultry industry. So they are number one in duck production. And of those cases, the 35 cases, 23 were ducks in duck facilities. Waterfowl add an added challenge to high path response. That is something that we don't necessarily have to deal with here, fortunately. They can be asymptomatic, they can act as silent carriers, and that makes finding the virus and probably finding it hard and spreading it really easily. And so while this is really kind of frightening to look at, I think we just need to make sure that we're keeping everything in perspective as far as what that might mean in Minnesota. Okay, so moving on to poultry dealers, because I don't think I've probably ever really talked to you about it before. But per our Board of Animal Health rules, so this is pulled from our rules. If you are maintaining or operating as a poultry dealer where you buy and then resell and distribute hatching eggs, poultry, or ratites. Ratites are our large flightless birds. I don't know if we have any ratite dealers in the state. But you need to have a permit from the board, and there are some specific sourcing requirements. And one of the big things that I'm going to highlight today is the record keeping expectation for those dealers. So they need to maintain records for 3 years on anything that comes into their facility and anything that goes out of their facility. And we've been working really hard with our inspectors in the field who go out once a year to inspect all of these facilities. And they do it in the springtime because that's when everybody's selling those baby birds. So these are the Tractor Supplies, the Runnings, all of those little farm fleet stores that sell chicks in the springtime. Those are the stores that we're targeting. So right now we've probably got about 250 stores within the state that we permit. And so these are kind of their expectations for record keeping, and that we need to know who they're buying their birds from. So I would say, I don't know, maybe 90% of them come from Hoefs, right? Hoefs hatchery is a big mail order hatchery in Iowa. But we want to make sure that those sources are participants in the National Poultry Improvement Plan. And then they need to keep track of all of the poultry that comes into their facility within the past 12 months is what we're looking at when we go out to the store to inspect. So we actually want to see documentation that they're keeping those records. And then anything that's distributed. So anybody who walks in the store and buys 5 chicks, we need to know their name and address and what they bought, so that if we do ever have a disease investigation, we've got that traceability. We also ask about outstate sales. So this isn't probably an issue for many of our stores that are located kind of within the central part of the state. But any of our stores that are located on the border, we have all the time where people come across the border to buy those birds, and then they take them back home. So now this is an interstate movement that we want to make sure that we're tracking and that we're providing that information to our neighboring states, that there are indeed livestock moving across state lines. And so we look through the records, we ask about outstate sales, and then we make sure that they understand that there's import requirements for people crossing the state lines, and that they're using the appropriate certificates. So this is something we've really drilled down with our dealers over the last couple of years to make sure that we're capturing this. And so you can imagine those on the North and South Dakota border, Iowa, Wisconsin, right? Kind of those Moorhead, like half of their sales go across to North Dakota, which is not surprising, right? Because it's Fargo, Moorhead. And so it's a lot of paperwork for them, but it really helps. And we've double checked a couple times with some of those receiving states if they do indeed want to get these movement certificates, and they say yes. One of the other things that we look at while we're out there is the sanitation and cleanliness of the facilities. So these are the questions on our inspection report. It's kind of a subjective assessment, of course, but are the poultry areas being maintained in clean and sanitary conditions? So this becomes especially important for the stores that have birds on display, right? We want to make sure that customers coming through aren't picking stuff up, but it's also an issue even for those who place orders for customers, leave them in the box, and then the customer comes and picks in. We want to make sure that those birds are being handled appropriately, that they're being kept in a warm environment so they stay healthy, and that they overall, appear in generally healthy condition. We also ask about a mortality disposal plan because, sometimes little birds do die, especially if they've had multiple shipments come in. And we just want to make sure that they're disposing of those birds appropriately per our board rules. And then to kind of go along with the update that Stacy provided you is even though this question in particular is not in our board rules, we think it's an important kind of One Health concept, and we want to make sure that their customers are staying safe. So we ask about public health measures. Do you have a hand wash station nearby? Do you have hand sanitizer? Is there a physical barrier so that, people can't reach down into the bins where the poultry are kept and touch them? And then are you providing information that's an educational about salmonella and other disease transmissions? So these are all questions that we ask. And so you might ask, why do we care about these poultry dealers, right? They pop up, they sell birds for a couple of months out of the year, and then, they're back to just their farm supply sales. I think it's important that we make sure that, birds being sold within the state meet the basic requirements of the National Poultry Improvement Plan, so that people buy those and they understand that there's at least kind of minimum standards that are being met. It also establishes a good point of contact so that, their customers know that they're following all state rules. The stores know that they've got a resource if there are animal health issues in the birds that they're holding through the facilities, that they know who to reach out to. We ensure that our neighbors are getting all of the information that they need. State import requirements are being met. And it's also kind of that first point of contact through a lot of the kids that are buying birds for 4-H or for the county fair, right? And so we, through that relationship, we're able to provide that statement of origin forms that their birds are sourced from an NPIP approved hatchery. And then most importantly, it's that disease traceability. So we work with the Department of Health every year on cases, unfortunately, cases where people have become sick with salmonella. They bought them from a store. And so then we're able to kind of help with that disease investigation and get the information that we need to know where those birds came from, what hatchery they were sourced from, and then, kind of reach out and provide that One Health approach. We have not had to deal with high path disease transmission, but, that or the next disease, of the day certainly could be in place. And so I think it's really important that we're maintaining that relationship and keeping all of those records. And then the last thing that I want to mention is we've got an NPIP biennial conference. By the name, it's a conference that occurs every 2 years, just like it's occurring in August in Salt Lake City. And so at that biennial conference, we do encourage and try to make sure that we've got delegates for each of the different subparts within NPIP. So, Erica, if you want to stay involved with this, you could come along as a delegate. And so we try to make sure that we've got somebody representing each of those subparts, because that is our opportunity to be able to vote on changes to the NPIP, and we want to make sure that all of the industries are adequately represented. The other thing that's open, and maybe I did mention this last time, the General Conference Committee is the Federal Advisory Committee to the NPIP. Minnesota falls within the West North Central region, and we are looking for candidates to be able to sit on that committee. So if anyone is interested, they can certainly throw their names in the hat. And then the last thing that I'll mention, I've already kind of said this proposed changes, right? So anybody, whether you're an NPIP participant or not, can put forward a proposed change to look at updating or changing the Code of Federal Regulations or our program standards. I may have talked to you in the past about the frustrations of the VCAP program. And one of the frustrating things is that the VCAP auditing program, which is specifically for high path, differs significantly in what is being done with the NPIP security auditing program. So we've got two different audit tools that don't jive. They're looking at different things. They're both, requirements, depending on where you are within that high path response. And when I have asked the question to say, for those participants who have had a BCAP audit, can that be used in lieu of their NPIP audit? And I was told no. So we're creating twice the amount of work to be for all of these audits. And so this is actually some language that I put forward as a proposed change. And the big thing that I just want to, put in here is that I added a sentence that just says a successfully passed BCAP or BIFA, that's that voluntary biosecurity audit that you can do, can be used in place of an NPIP audit if acceptable to the official state agency. So this is not official. This is just something that will be considered at the biennial conference. I did talk to quite a few people before we put this forward, so you can see the list of our sponsors here. We've got people from producers in Minnesota, veterinarians in Minnesota, the University of Minnesota, Michigan, and Kansas are all supportive of this. So that kind of just helps to, support your efforts when we all show up to the biennial kind of working towards the same thing. And that's what I have for updates. I'm happy to take questions.
Any questions for Shauna? Right, thanks for your update.
Thanks for carrying that. That's redundant.
Yes.
All right, I've been cosplaying as Erin all day, so now I'm putting on my Katie hat. And I know you've all seen this popping up in the background and have been waiting on the edge of your seats to hear about some tag numbers. You love those last presentation of the day. Oh, did it? Not save. Well, okay, I didn't change much anyway. So I'm going to talk about how the past RFID tag distributions have gone from USDA. I want to credit this presentation to Tina, who's the USDA Animal Identification Coordinator. So we work together on a lot of the distribution, and I asked her to kind of run some numbers to kind of see how this has progressed over the last couple years. Oh, she had animations in there. Okay, so there you have it. So the metal tags are out and RFID tags are in, as you know, for cattle. It's required that they be visually and RFID tags to be considered official. Convention is to use orange ones for brucellosis, but just always a reminder that it just has to be official ID for vaccinating cattle with brucellosis. The orange is just a convention. But if you do have the official vaccinate tag, they do have to be a vaccinate. So going on to, we're going to start with fiscal year 2024. And, we have like 3 different fiscal years we're talking about. So this is talking federal fiscal year, which starts October 1st. But the USDA, as a reminder, I haven't talked about this for a while, has, in creating the requirement that cattle have RFID, did kind of a distribution system to the states. So for fiscal year 24, our state was allocated 150,000 tags. They did kind of have their total number of tags they purchased from Allflex, and then kind of divvied it representative of the size of the state's industry. So obviously this does not represent all cattle that require ID in our state, but it's what we were allocated. So for that fiscal year, so my first kind of round, just after starting with the board, here's kind of the breakdown between producers and tags. And because herd size vary greatly between beef and dairy, especially in the state of Minnesota, I have things broken down by tags and by producers. So after this initial distribution and kind of seeing how the numbers, shook out, then I was looking for fiscal year 25 to make sure to get it as equitable as possible. So here we see a lot of dairy producers, a lot of veterinarians, and a little bit, this is a generalization, but the dairy industry has already adopted this technology a little bit more than the beef industry. So then I was looking to maybe target some of the communications to the beef industry a little bit more, and also to veterinarians, because they're often that point of contact and often applying the tags. So for fiscal year 25, it was a little bit unique. It was split into 2 rounds to mix it up. So first round, we were allocated 121,000 tags. And the goal for me has been to get rid of them. So we show USDA like, hey, give us more. We're going to use our allocation. And we did. And so that, when we put that form, it opened April 8th, and within, both times within less than a day and a half, all tags were spoken for. So I was trying to really do communication on the front end so that there'd be as much equal opportunity as possible for access to these tags. And then I'm going to show this in little like graphs too for a little bit more of a visual. But we also see, I was trying to reach out to our bison producers as well, especially as the bison population is growing in Minnesota through some efforts through the tribes. So I want to make sure that they're aware of these opportunities. And also, hearing the needs from the industry, from markets as well, where a lot of tags get applied, and going from there. They changed distributors from Allflex to Datamars for round 2, because we used up all of our first allocation. We got another allocation for the second half of fiscal year 25. Well, it wasn't really on the calendar. It kind of went based on when they were able to get all the tags distributed. We actually had tags get to people very quickly because we got our orders in right away, whereas I think for fiscal year 25, there might even be a few stragglers being distributed now, but we were able to get all our tags out really quickly, and didn't have complaints on this fiscal year 2025 on how quickly people got their tags, which was great. So any orders that were 1,000 or over, they came directly from the warehouse, and Tina arranged that. And then to account for, us smaller beef producers and whatnot, any tags under 1,000, my team at the office personally counted out and distributed from our office, so we could kind of address that, industry a bit better, because, a lot of producers don't want to order 1,000 tags if they have 20 cattle and not a high replacement rate. They don't want those sitting around. So that's kind of how we were able to address this. And then the numbers here, again, I think getting to the graphs is maybe a little bit more helpful, but here's just the raw numbers as is by number of orders and number of tags. So what I think is maybe a little bit more interesting is comparing. So here, number of tags, we have it broken down by what happened 2024 versus the rounds of 2025. So as you can see, got a little bit more engagement from bison, and then also kind of we're increasing in our market veterinarian distribution. We also, for fiscal year 2025, put in place a trade-in program. So a lot of the markets were like, okay, well, I have 10,000 metal noose tags sitting around that are, what do I do with those? And it's like, well, you can use them in cervids or swine. They're not very popular to use in swine. Or we let them trade in up to 5,000. This is the only way that markets could get them, directly, was trading them into us, those metal tags. And then I sent them RFID tags to kind of, account for this transitional period. And then some of the numbers on, that's number of tags. Okay. And then we get in the percentages, which I like a little better, breaks it down. Again, I think I'll just go right to the graphs since we've been going over a bit, and they're a little bit better of a picture. So this is going based on number of tags. So, you know, keep in mind the dairy herds tend to be larger than beef herds, so that's one thing was kind of accounting for. But we do note that there was kind of an increase in providing them to market veterinarians. I made sure to reach out to all the market veterinarians individually, so they knew that form was opening and whatnot. And we see you know, dairy decreased a little bit over time, and you know, then there was the implementation of the trade-in program. So there was a spike for the fiscal year 2021, and then basically for the second round, it was just kind of the remaining markets that weren't able to take advantage of that still had tags the first time. So each of the markets only kind of got to trade in once if they had those extra tags, because I still wanted to make sure that veterinarians and producers had that access. And then what I was hoping is that, you know, percentage of tags to beef producers would increase, but I didn't quite see that. But there was also an overall trend of veterinarians getting more. So I think there's a little bit of explanation of offset there. So, and then in terms of, you know, the numbers of orders, this is how that broke down. So again, we see, you know, and keep in mind the 2025 was split into two, but we kind of see the number of orders for dairy going down, and then for vets going up, and in terms of those percentages as well.
Could you clarify what a non-market vet is?
Yeah.
Versus a market, I thought I.
No, totally. No, I did not explain it. So, our livestock markets are required to have a, you know, an official veterinarian on site. Official veterinarian meaning they are acting as an agent of the board. They are accredited with USDA, and they have specific duties that they are required to do. So they are, you know, employed by the market, agents of us, and work all of those sales that fall under our permitted or licensed auction markets. And then other veterinarians are just veterinarians in clinical practice that serve cattle.
Non-market.
Yes.
So you're talking about the beef market.
Yep. Yeah, exactly.
And
yeah.
Any guesses on skewing of non-market, market vet? Is that 90% dairy in both categories? Is market gonna be 80% beef? Any ideas?
Yeah, didn't really have the capacity to get those numbers. What I've seen kind of anecdotally with markets is in terms of animals that come without tags and require tags at market, that is more often beef animals than dairy animals. So I think that with the markets, it maybe went a little bit more to beef animals, because a lot of times animals maybe aren't required, especially, you know, certain non-breeding or feeding beef animals, they don't require the tag to go to the market, but then depending on who buys them, they're going to require it to leave the market. Whereas with dairy, pretty much for most movements under state and federal things, unless, you know, except for, you know, steers, and they require a tag to move at all. So it's more often beef that are tagged at the market.
Last question.
Yeah.
Were there any rules for the vets? And I don't, maybe, like, could they sell them, like the non-market vets, or is it only giveaway, or is there no rules?
No, there are regulatory requirements around tag application record keeping. And, you know, if tags are transferred, that's, you know, because we've had times where a producer or somebody is like, oh, you know, I'm closing down my farm and I want to give these tags to someone. We, within our, you know, system, will reallocate those tags to new sites. So they would have to reallocate them. I mean, not to say that nobody did that under the radar, I don't know. But overall, it was pretty clear that's like, these are for use here. And a lot of times they were, you know, kept in the vet truck or in a place for the vet at the market. But no, it was only for use at the market for those market vets.
in theory, Lucas, because we did have the situation, oddball situation where there were tags bought on eBay to apply, and they were California tags ending up in Minnesota cattle. So Dr. Schaefbauer and I had to kind of do some backpedaling to figure out how that happened. We got scolded a little bit, and I scolded right back that, what are you doing? I mean, they're sold on eBay. I can't control a California vet selling them on eBay. But
Always got a point.
Always so. So then looking at, kind of orders by category, we see a good proportion of them do go to vets we had with a little bit more of that communication. That second round, a little bit higher percentage going to be, because they went away quickly, and I did a little bit extra communication push with Minnesota beef and cattle producers that I hope for that. And then, again, kind of in veterinarians, a little bit of increase. So it's not a whole lot of data, but I just thought it was interesting and wanted you all to know, where these tags were going through this program. So overall, yes, so November 5th, 2024, when that new traceability rule went into place for cattle, it greatly increased the demand, and everyone was like, you're gonna give us tags, right? Like what happened with the metal news tags. And it was like, well, a little bit. Because the main, complaint about the RFID tags is the cost for producers. And, we try and kind of explain it as like a value added thing. And, it does help me from a traceability standpoint. And I'm definitely understanding that I'm like, oh, you have just like a herd of 10, I understand it was, it's been a frustrating transition for producers, mainly due to costs. So, and then, something from fiscal year 2024 from previous years is these tags were used for all cattle that require official ID, not just replacement heifers. Previous years, pre that and pre-me, it was for replacement heifers. We started that trade-in program, which I feel like was pretty successful. We have reallocated some of those metal tags to some cervid producers. We definitely have more than there are farmed cervids in the state. So if you know anyone that wants metal ear tags for their cervids or swine for whatever reason, we do have some at the board that we can give away for free in the old storage place. And between the fiscal year 2024 and 2025, there was, kind of a decrease in direct to producer orders and an increase in direct to veterinarian orders, who are often the ones applying the tags. So overall, I see that as a positive thing, because the veterinarians have a little bit more broad reach, and we aren't able to send out an email blast or a carrier pigeon to every producer in the state. So I hope that makes it a little bit more equitable distribution. So there was a large increase of tags going to livestock market veterinarians based on some of the industry feedback I was receiving in terms of what, how the flow of animals and where those needs were. And we're seeing producers get the tags from the veterinarians directly. And we in Minnesota were extremely successful at getting rid of our tags, having them ordered and distributed right away, which I think was really great compared to what I was hearing with some snags in other states. So, it wasn't always ideal if you weren't, hovering over the form button right when we opened it. But I am glad that we were able to get everything distributed in a timely manner, because, I think that's always helpful for producers when things are not feeling maybe on government time, because that's, we understand there's a little bit of a difference of magnitude there on that timeline sometimes. So in terms of what's going on fiscal year 2026, which we are in, we haven't received any tag allocation amount. They were still kind of wrapping up 2025. We do get notification, and by we, I mean, AIC and ABIC and Dr. Hoefs, about if we get another allocation. And Tina, worked with me and Avery Berry, my traceability program admin, very closely to kind of get everything planned and ready to go for when those tags are available. I don't, actually know if this program is continuing or plan to continue. It's just, a little bit of a wait and see, but if we do get any news that there is going to be an upcoming or future allocation of these distribution of tags, then, we give our staff a heads up and we'll start, preparations so that we can have the same amount of success in distribution. Yeah.
Can we, so I've had a couple producers and a couple of vets come up to me and complain how they didn't have the opportunity to get those tags. Is there any way we could order more? I know costs and all that stuff, but.
For new USDA, we cannot get any more
Okay.
no cost ones unless those are offered to us, and I don't think it's in our budget to provide them free from the state, so.
Okay.
They give us the number they give us, and again, I don't know what the future of that program looks like. I know USDA has been really focused on screwworm and other things, so I don't know kind of what's going on in traceability land. Have you gotten any updates on that? Or
No, I was just gonna follow up on that. Do you have a way of tracking who got the tags last time? So you kind of spread the wealth. I mean, are they getting repeat orders, or are you able to determine this producer, this veterinarian got us a bunch of tags last time, we're moving on to the next ones? How do you?
Yeah, to a degree, we do have, I love a good spreadsheet, so I did do it with my team on like a spreadsheet system. There is a little, because when we get hundreds of orders, there's a little bit of a labor intensive thing to that, and some of the orders go directly to Tina, but we could maybe see if there's, a not incredibly labor intensive way to do that, because I agree, that, if I were somebody and I knew I could get them the first time, I'd be waiting for the next one, and we opted not to do some sort of a wait list or something, because when we don't know how many we're gonna get, we don't know when it's coming up, we didn't want to kind of set ourselves up for a bit of a mess. So we would just, the people that would check in with us on, hey, when is this opportunity going to present itself again, because I didn't get them last time, I'd kind of keep them updated on like, oh, well, here's, kind of when you can expect that, and just keep in touch with those people. But yeah, we can try and see if we can make that a little bit more precise.
Are there any other questions for Katie? All right. Thank you for your update. Is that it? That is it.
And what do we call it? Can I have the floor?
Yes. You can have the floor.
I'm having the floor.
Vice President.
I beg your pardon. It's come to, this is a little background. It's come to our attention that Alex Stead has applied to be the tribal representative on our board. He is currently a member of the board. And I'm not even going to speculate on any delays or anything, but we know there has been a delay. He has not been reappointed. So I would like to make a motion, President, to extend an invitation to Alex to continue to sit with the board until the executive appointment has been resolved. Do I have a second? Do I have a second?
Second that.
We have a second. Any discussion? You know all the facts I know, basically.
Can we just double check with Andrew if there's any statutory language that prohibits this, or if it's necessary?
You just wouldn't be able to vote. You can still sit here and, comment on meetings and such, but you wouldn't be able to vote until there's been a reappointment.
I would check that out.
But good to have that comment on record.
Yeah.
That's good.
So am I allowed to go into the closed session then?
Oh, yeah, you're still.
Okay, okay,
Yes.
okay.
I think it's just in future meetings.
Future, okay.
Something hasn't resolved by the next meeting.
I asked for the motion, yes, motion.
You have
Yes, could you hold the floor?
Okay, that's right.
Have the floor.
So any further discussion? Further discussion, seeing no more discussion or comments? I called, for no. All those in favor?
Aye.
Opposed? Passes. That motion carries.
Thank you.
Oh, power got to be there.
Well, all right, speaking of power, it is that time that we have the elections of our board officers. Are there any nominations for the board president?
Madam President, I have a nomination for the board president, Brandon Schaefer.
I second.
Brandon Schaefer has been nominated for president. Are there any other nominations?
I move to close nominations and cast unanimous ballot for Brandon Schaefer for president.
All right, it's been motioned and is there a second?
He seconded it.
Yes, okay. Oh, it's been motioned and seconded to close nominations and cast a unanimous ballot for Brandon Schaefer. Is there any discussion? Any discussion? All in favor, say aye.
Aye.
Opposed, same sign. All right, motion carries. Congratulations, Brandon. I forgot to ask if you consent, but it's too late. All right, so we will now move on to the position of vice president. Are there any nominations?
Madam Chair, I would nominate Dr. Peggy Hawkins. No. Sorry.
There goes your power.
There goes my fault. Dr. Jessica Fox as the vice president.
Dr. Jessica Fox has been nominated for role of vice president. Are there any other nominations?
I would move to cease nominations for closing nominations and cast unanimous ballot for Dr. Fox for our vice president.
Just second.
No, but can you just make the motion?
Oh,
So is there a second to close nominations?
I'll second to close nominations.
Yes. Okay, so it's been motioned and seconded to close nominations for vice president role, cast a unanimous ballot for Dr. Jessica Fox. Any discussion? All in favor, say aye. All opposed, same sign. Okay, motion carries. So then now we have to vote
on her being,
yes,
because we just said we'd do it.
we would close it.
Yeah.
Okay. Nominations have been closed. Dr. Jessica Fox has been nominated. All in favor of, no, but I have to ask for, now I'm confused. I'm still sorry. Okay, so how do I word this?
All in favor of having.
All in favor
Dr. Fox as
of
our vice
Dr.
president.
All in favor of Dr. Jessica Fox as our new vice president. Say aye.
Aye.
All opposed, same sign. Motion carries. I'm so sorry I botched that. Congratulations to our new officer team, Brandon Schaefer as president and Dr. Jessica Fox as vice president.
I'm gonna take the floor again. Sure. Oh, now the power's in out. Erica, I'm gonna cry.
Please don't, you're gonna make me cry.
It's gonna be a little card. I think if anybody did inside the cards wants to, I think everybody did. little memory of your time here and so much. We've been through a lot. Couple of, yes, a couple of state veterinarians, a couple of kerfuffles with, servants. And a couple of fun times too. And we have a really great board, but it's only as good as its leader. So, thank you. I think,
Yeah, we got that. We have. I can get to.
Oh, thank you. Why? Yes. Oh, it's flowers. Thank you guys so much.
I feel like I need to say thank you. I have really appreciated my time on the board. You all are a great group of people and a great agency. We have been through a lot, but we have a good team. I mean, I've made it through because I've had good people to lean on for all of this. A lot of life has happened since I've been on the board. A lot of life. When I got on the board, I didn't have children. So I guess it's only fitting that my oldest gets to come with me to my last board meeting. So, but thank you all for everything that you do. I'm just a phone call away. I'll always be a supporter of the board. So please don't be strangers, and I won't be a stranger as well. So with that, let's go talk about our state vet. We are now reopening our meeting. 2:47. It was motioned. There was a motion to reappoint Brian in his position, and the motion carried. So congratulations.
Thank you.
Sweating bullets.
Well, I'm surrounded by Stephan and Shauna and Eric. Boy, taking a long time.
I'm Hoefs, this is what we were doing.
Time well spent.
All right. With that being said, is there a motion to adjourn?
Actually, I'm sorry, can you guys get your December meeting planned? We need that, because of planning. She's gonna need to get that straight.
Sure. Okay, before we adjourn, please pick out a December date.
December 9th. Wednesday.
It's my birthday.
That could work. You're celebrating birthday.
December, can we have cake?
I'll bring cake.
December 9th,
December 9th.
December 9th.
Peggy's birthday.
Peggy's birthday, Dr. birthday.
He's 70.
30?
Huh?
Maybe 30?
I will be 70. I'm proud of that.
All right, December 9th has been selected as the December quarterly meeting. Is there a motion to adjourn the meeting? Is there a second?
Second,
It's been,
second, third.
any discussion? All in favor, say aye.
I.
Opposed? Motion adjourns, or meeting adjourned.